Thank you. Hello everyone, very good evening to all of you. Am I clearly visible, audible? Give me a minute to open the chat box. If I'm clearly visible, audible, you people can write something in the chat box that I'm clearly visible, audible. We will start the session ahead. So give me a minute to confirm. We will start in next few seconds. So waiting for your confirmation. All the students who have joined me live, I'm requesting them to confirm if visibility, audibility, everything is good to go. We can go ahead. Okay, thank you, thank you. So Medico Asad, is it clearly visible, audible? You can see my slides also. We can go ahead. So I welcome you all for today's session. A very, very good evening to all of you. I am Dr. Priyanka 𝗧𝗲𝗹𝗶𝗃 here, and today we are going to discuss the pharmacology, ultra important topics in pharmacology. So basically I will be discussing you nearly 30, 40, 50 PYQs. Some PYQs we will discuss, as many as we can today. So not only the question answer form, you know my way of teaching. I don't discuss just question and answer. I discuss that topic completely. Now in any exam you are targeting, specifically this session is for FMGE students because the PYQs I am covering are from FMGE PYQs specifically. So in FMGE exam, the topics are repeated. Students think that the questions are repeated. No. The same question will not be there. Hardly it will be there. So, but yet same topics will be there. So you have ultra important 50 to 100 topics that you must learn very well, right? So today I am going to cover the ultra important topic in pharmacology, the general pharmacology as well as systemic pharmacology. Let's see as many as we can do today. So I will super simplify the concepts for you. It will be cakewalk for you after the session, right? So without wasting any further time, I guess we must start. I guess you people are ready. Okay, thank you for confirming. Thank you all. So we will discuss in the form of the question answers, right? So first I will launch a question in front of you. You have to read the question, see the option. Tell me according to you what is the correct answer in the chat box. If it's wrong also, it's okay, but try, at least try. After that I will discuss that topic completely and show you the same question again, and then it will be perfect. So not only this question, any question coming from this topic you can solve. That is the purpose. Okay, so read the question, tell me the correct answer. Okay, so pharmacodynamics deals with what? Let's start with general pharmacology only. Pharmacodynamics deals with what? Is it effect of drug on the body? Is it effect of body on the drug? Or is it absorption of the drug? Or is it metabolism of the drug? So most of the students are saying A. So I want everyone to participate. Say something, whatever you think. It is not the thing everyone is saying say A, so you should also say A. So use your brains, read the question. Yes, the correct answer is A. I will come on the question again. Let me tell you, in pharmacology, what is pharmacology as a subject? It is the study of the drugs, of course, right? So in pharmacology, we are having two branches, pharmacodynamics and pharmacokinetics. So pharmacodynamics, what the drug does to the body, that is pharmacodynamics. And what is pharmacokinetics? What does the body do to the drug? Now saying these two lines just opposite to each other, it's very easy, but understanding is important, right? Now just suppose I'm having headache because of migraine. Example, I'm not having that. So just suppose I'm having some disease. Suppose I'm having headache of migraine. So I want to treat it. For that I'm taking a drug. I'm taking the drug by oral route. Okay, so the drug will go inside. I want the drug to go inside. After that it should be absorbed in the blood. After that, via blood it should go to my brain, to my central nervous system, the blood vessels of my central nervous system, and cure the disease, treat the disease for whatever purpose it has taken. Just suppose I am having heart failure. So I want the drug to go in the heart, you know, myocardium, and increase the contractility or whatever. If I am having diarrhea, I want the drug to go in the intestine. You got my point? So drug, what the drug is doing to the body, drug is showing its mechanism of action. So different drugs have different receptor. The drug I am taking for diarrhea or constipation, its receptors are present on the intestine. The drug I am taking for the heart failure, its receptors are present on the myocardium of the heart. The drug I am taking for migraine, its receptors are present in the CNS parenchyma or the blood vessels of the CNS parenchyma, right? So different drugs have different receptors. So according to that receptor, the drug will go to a receptor from the blood and it will act accordingly. So mechanism of action of the drug, for what purpose we are taking that drug, that is the effect of drug on the body, right? So that is known as pharmacodynamics. You can learn D for D, you will not forget. Dynamics ka D is drug ka D. Dynamics matlab D for drug, effect of drug on the body, right? But just suppose there is a tablet or capsule in my hand. Just looking at it, will it cure my disease? Of course not. I have to apply it. I mean, either I have to take it by oral route or some injectable route or subcutaneous route. I have to apply it or take it in my body. No? So it does not show its action, just looking merely its name or merely saying it. So what is the effect of the body on the drug? Let me show you a diagram to explain you this completely. You can see this is the complete diagram. You can see this is the drug. I am taking by oral route. Most easiest, cheapest way, conventional route is oral. So oral route, we are taking drug. Just suppose the person is having headache and we are taking the drug for that. So the drug first go in the mouth, then it will go in the esophagus, then it will go in the stomach as well as intestine. Now there is a rule. The acidic drugs are absorbed from acidic medium and basic drugs are absorbed from basic medium. We all know stomach have acid, the hydrochloric acid, and we all know in the intestine there is basic medium, alkaline medium. So acidic drugs are absorbed from the stomach and basic drugs are absorbed from the intestine. Please learn this concept. Drug is absorbed from the same medium. There are two types of drugs. Some drugs are acidic, some are basic. So my point is that acidic drugs are absorbed from acidic medium, that is stomach, and basic drugs are absorbed from basic medium. In the meanwhile, I will give you a list. Which drugs are acidic, which drugs are basic. We cannot learn the list for million of drugs, but the important 5-10 drugs we will learn. The acidic drugs and basic drugs. Okay. So acidic drug or basic drug, whatever it is, ultimately it is absorbed. है ना? So this step is known as absorption. What do you mean by absorption? The first step is always absorption. Absorption is the movement of the drug from the site of administration to circulation. The site of administration here is oral. I can give it to the muscle also, intramuscular injection. है ना? I can give it to subcutaneous route also, topical route also. There are many routes you may be knowing. है ना? So whatever is the site of administration, from that drug should move to the blood, to the circulation. And this step is known as absorption. So the body is doing the absorption. The first thing is absorption. After reaching in the blood, now some drug will remain free and some will bound with the protein. That is bound from, it's different thing. Okay, leave it. Now drug will move to its site of action, whatever the drug is supposed to be. So different drugs have different receptor. I'm saying I'm taking the drug for diarrhea, it should go to the intestine. I'm saying I'm taking the drug for the migraine, it should go to the CNS, brain. I'm saying I'm taking drug for heart failure, it should go to the heart. Whatever is the site of action, from the blood, drug should move to its site of action. This step is known as distribution. What is the definition of distribution? Again, movement of the drug, but from what to what? Movement of the drug from the blood to its site of action. This is known as distribution. Okay. Now, after distribution, we cannot keep the drug forever in the body. Of course, I'm having diarrhea today, so I'm taking a drug for it. My diarrhea is cured, it's treated. So I want the drug to be excreted out. I want the drug. Now, most of the drugs, 99% of the drugs are excreted in urine. Some are excreted in feces, saliva also, but most of them are excreted in urine via kidney. So finally, I want excretion now. Because the drug has already shown its action, I want the drug to be excreted. Excretion is the movement of the drug from the blood to the urine, out of the body, right? But there is a problem. What is the problem? The problem is that the urine is liquid. The urine is water. So only polar drugs are soluble in water. Non-polar drugs are non-soluble in water. Of course, we know the basics. So most of the drugs, many drugs are non-polar also. So you cannot directly divert them, go to the kidney and get excreted. So the non-polar drug, they will directly get excreted. But the non-polar drug, they cannot be get excreted. So first you have to convert non-polar drug to polar drug. And then they will be excreted. So this step in which we are converting a non-polar drug to polar drug, right? This step takes place in liver. And this step known as metabolism or biotransformation, one and the same thing, whatever you say. So third step is biotransformation or metabolism, that takes place in liver, in which the non-polar drug get converted to polar drug. And finally, the drug is excreted out of the body. Give me a thumbs up. You got it, everyone? How many of you got it? So I told you 4 things. The first, drug get absorbed, then the drug get distributed, then the drug get metabolized, and finally the drug get excreted. So these are the 4 things the body is doing on the drug. My point is that the body is absorbing the drug, the body is distributing the drug, the body is metabolizing the drug, and finally the body is excreting the drug. Meanwhile, in second number step, what is the second number? The second number is distribution. Whenever there is a distribution, the drug is showing its mechanism of action here at the site of the action. So this step is pharmacodynamics. So pharmacodynamics is shown to you only one thing, mechanism of action. But pharmacokinetics is 4 things. You can see what the body is doing to the drug. There are 4 things. Absorption, distribution, metabolism, and excretion. What the drug is doing to the body, only one thing, mechanism of action. So pharmacokinetics have 4 portions. Pharmacodynamics have only 1 portion. Did you got it, every one of you? Did you have any confusion in that? Can we move further? So this is the basics, you know, starting pharmacology with this concept. Okay, so this is the thing. Pharmacokinetics is what the body is doing to the drug. First, body absorb the drug, then body move the drug from the circulation to the site of action, that is distribution. Then body metabolize the drug, that is convert non-polar to polar, and finally body excrete the drug. And during distribution, the drug show its mechanism of action, that is known as pharmacodynamics. So what we learned pharmacodynamics, pharmacokinetics. Now learn D for D. Pharmacodynamics, what's the drug does on body, okay, what the drug does on body. And pharmacokinetics, what the body does on drug, right? So that is the thing. So you can learn, like again and again I am saying D for D. Okay, so pharmacodynamics have only one branch, that is mechanism of action of the drug, but pharmacokinetic have 4 branches. What are these? Absorption, distribution, metabolism and excretion. You can learn a mnemonic ADME. So because of learning the mnemonic, don't get complicated. You can imagine the diagram I have shown you. First absorption, then distribution, then metabolism, and then finally excretion. I hope it is crystal clear. Can we go ahead? So this is the basics. So we have solved one question, so you can learn ADME, absorption, distribution, metabolism, excretion. Okay, now a few more questions based on the same concept and quickly move on another concept. Okay, pharmacokinetics includes study of all except, now everyone can answer. I want each and every one of you, how many of you are live? Each and every one of you, please answer in the comment section. What is the correct answer? Absorption, distribution, adverse effect and excretion. What is not included in pharmacokinetics? They are asking except. What is the correct answer? What is the correct answer? Tell me. Yes. Yes. So, Jyotsna, you are saying C. What about others? Yes. So, Asad is also saying C. Yes, everyone is saying C. Very good. So, I told you absorption, distribution, metabolism, excretion. Absorption is there, distribution is there, excretion is there, but adverse effect is not there. Adverse effect is not there. So, correct answer is C. You got it? One more question. Pharmacodynamic includes what? What is pharmacodynamics? D for what? Drug elimination, drug excretion, drug absorption, or mechanism of action? What is the correct answer? I guess question is simple, super simple in front of you. What do you say? Yes, you all are right. I guess everyone is right. The correct answer here is D. It's the mechanism of action of the drug. Coming on the next question, right? The next concept, I mean. Which is the best way to manage a patient presented with aspirin poisoning? Imagine you are a doctor, you are sitting in your OPD and there is a patient coming to you having aspirin poisoning. By mistake, he has taken too much of aspirin, or intentionally he want to do suicide, commit suicide, and intentionally he had taken too much of aspirin. Whatever. The patient is under aspirin poisoning and you want to save this patient. What do? You want to make the urine acidic or you want to make the urine alkaline? You want to make the acidic urine via adding ammonium chloride, or you want to make the urine alkaline by adding sodium bicarbonate, or you will treat with an acetylcysteine, or you will do the gastric lavage. What do you think? Give a guess, at least a wild guess. Yes, what is the correct answer? So for understanding this question, you must understand aspirin is an acidic drug or basic drug. What is aspirin? Aspirin is an acidic drug, you know. So the correct answer here is B. Let me explain you the explanation completely, then I will show you this question again. You all will be able to answer. So learn few examples of acidic drug and basic drug. The first thing you have to understand, aspirin is an acidic drug. Okay. Whatever drugs we are having, most of the drugs are electrolyte. Electrolyte. In chemistry, you have learned what is electrolyte. Few drugs are non-electrolyte also, but non-electrolyte drug do not depend on pH. So neither their absorption depend on pH nor their excretion depend on pH. Right? We are talking ना, हमको urine को acidic बनाना है कि basic बनाना है. That is, we are talking about the pH of the urine. So हमें अच्छा. So these are non-electrolyte, but electrolyte drugs depends on pH. Electrolyte भी, there are 2 types of electrolytes: strong electrolyte and weak electrolyte. Weak electrolytes are always partially ionized. I will explain all this concept to you. Wait a while. So let me tell you the summary first. Okay, imagine this is your patient. This is the diagram of your patient. Imagine this is the drug. The patient is taking the drug via oral route. So where the drug will go? The drug will go in the mouth, it will go in the esophagus, it will go in the stomach, it will go in the intestine, then it will get absorbed and go in the blood. So what do you want? What do you want? Being a doctor, let me ask you a question very clearly. Being a doctor, what do you want? Your drug should be absorbed or excreted? Please answer. What do you want? Being a doctor, what do you want? The drug should be absorbed more or excreted more? The drug should be absorbed more or excreted more? Simple question, simple answer. Please say something. What do you want? The drug should be absorbed more or excreted more? You are giving a drug. I mean, the patient is in front of you and the patient is taking the drug. What do you think? Write down something. Come on, be interactive. Yes. What do you think? So most of the students may be thinking that drug should be absorbed more. No, it is not always the scenario. If you want to, yes. So if you want to treat the disease, you want the drug to be absorbed more. But in this scenario, the patient is in poisoning. Medico, the patient is in poisoning. You want more absorption? No, we want more excretion in this case. Right, so depending on the scenario, if we want to cure a disease, we want more absorption. But if a poisoning case is in front of us, in that case, we want more excretion. So depending on scenario to scenario, no, it's not always true. So that's why I asked this question. See, most of the students are saying absorption, but it depends. In this patient also, you want this absorption. All those who are saying absorption. This is a case of poisoning. You want more absorption, patient will die. Huh? Patient will die. You want excretion in this case if you want to save the patient. So my point is that it depends on scenario to scenario, right? In poisoning cases, you never want absorption. You want as soon as possible excretion. Got my point? Got my point? Now, is there a way we can make absorption of the drug faster or excretion of the drug faster mechanically? Yes, there is a way. There is a way. There is a way of both, right? So for absorption, listen the rule, the golden rules, two golden rules, one for absorption, one for excretion. Absorption occur in same medium. Acidic drug absorbed in acidic medium, basic drug absorbed in basic medium. Excretion occur in opposite medium. If you want to excrete acidic drug, make the urine basic. If you want to excrete basic drug, make the urine acidic. Crystal clear, I have said, without any confusion, right? You can see for absorption ke liye we are having two organs, hai na? So I am saying acidic drugs are absorbed in acidic medium, that is stomach. Stomach have the acidic medium. We all know our stomach is having HCl, and the basic drugs are absorbed from basic medium. So intestine have basic medium, alkaline medium. So my point is that acidic drugs are absorbed from stomach and basic drugs are absorbed from intestine, right? So same medium for same drug. Acidic drug, acidic medium, basic drug, basic medium. But absorption is required for curing a disease. Currently we are dealing a poisoning case. We do not want absorption. We want excretion. For excretion, organ is only one, kidney. We don't have two different organs like stomach and intestine for absorption. We have only one organ, kidney. But in kidney, urine is present. We can change the pH of the urine. Urine can be acidic, can be basic, but giving certain drugs, we can make the urine acidic and basic. I will tell you how. And we can make the urine acidic as well as basic. So if you want to excrete acidic drug, make the urine basic. And if you want to excrete the basic drug, make the urine acidic. As simple as that. Anna, both the drugs will be ultimately excreted in urine only. Got my point? Got my point? Say yes. This is the first concept, the biggest concept I told you. Most of the students are confused in this. I don't know. Learn two golden rules. Teesra golden rule I will tell you. If three golden rules are known to you, the complete concept is like cakewalk. Two golden rules I already told you. What are the two golden rules? I told you acidic drug, absorption occurs in same medium. Occurs in same medium. Same medium. That is acidic drug, acidic medium, basic drug, basic medium. But excretion occurs in opposite medium. Acidic drugs excreted in basic urine, basic drugs excreted in acidic urine. Now you will never forget. This is the basic golden point you must understand. If you want to understand the reason, I will tell you the reason also. Okay, listen this. Now let me tell you the ionization, ionized and unionized form ka funda, right? Imagine an acidic drug and basic drug both. Let's divide the page into two portions. Acidic drug, let's take an example of acidic drug and let's take an example of basic drug. Okay, what is the acidic drug? What is acid? Let's take an example. What is acid? HCl. All the acid have proton, HCl, HNO3, H2SO4. H is always present in all on all drugs. So let's say HA, HCl, H2SO4, HNO3. HA is the acidic drug. A kuch bhi ho sakta hai, but H is constant, it's a proton. And what is the basic drug? NaOH, KOH, CaOH, NeOH. OH is constant, है ना? So let's say BOH is a basic drug, है ना? B can be anything, ठीक है? So these are the two acidic and basic drugs we have taken. A for acidic, B for basic, है ना? So they will ionize like H positive and A negative, and they will ionize like B positive and OH negative. Don't go in the details of the chemistry. It's not a chemistry session, right? But just I will give you an overview. Overview is that here also this is known as unionized form. Unionized form. Unionized means complete, bina tuta hua. It's complete, है ना? And this, the broken one, it is known as ionized form. It's an ion, no? It's an ion, you can see. And here also it is known as unionized form. Unionized form, and this one, not this one, I'm sorry, this one. This one is known as ionized form, है ना? Ionized form. So every drug, whether acidic or basic, it is having ionized and unionized. The rule is that बॉडी को क्या चाहिए, टूटा हुआ कि बिना टूटा हुआ, बॉडी वांट कंप्लीट और द फ्रैक्शन, बॉडी वांट कंप्लीट, जो भी टूटा फूटा है उसको निकाल दो, एक्सक्रीट कर दो. सो प्लीज लर्न लाइक दैट. Unionized form is absorbed and ionized form is always excreted. It is a rule, the golden rule. Ionized form is absorbed and unionized form is absorbed, ionized is excreted, because you can learn like ionized is broken. Now why body will say take the broken, it will excrete out the broken, but the complete thing body want to retain, so that's why more absorption. So body always absorb the ionized form and body always excrete, kidney tries to excrete the ionized form. Again a golden rule, again a golden rule. Please learn this golden rule, right? Now let me summarize everything, right? Let me take the two things in front of you. Let's talk about two things and do the summary. So let's talk about acidic drug and basic drug. If you want to write, you can write it down. The final summary, the final verdict. Acidic drug, basic drug. Tell me where the acidic drugs are absorbed, in which medium, and where the acidic drugs are excreted. Same also you tell me for basic drugs. You know that. So for absorption, same medium is required. So acidic drugs are absorbed in acidic medium and basic drugs are absorbed in basic medium. But for excretion, opposite medium is required. So acidic drugs are excreted in basic medium, but basic drugs are excreted in acidic medium. That we have already understood. Now let's apply the concept of ionized and unionized drug here. Okay, what I told you here for absorption, which form is absorbed? Body absorbed which form? The complete one, the ionized one. So ionized, I'm sorry. The complete one is the unionized, and I got confused. The complete one is the unionized, है ना? So here unionized drug will be there, and here also unionized drug will be there. Okay? And the excreted, which form is excreted out of the body? The broken one, the one which is ionized. So ionized one is excreted out, and here also. So this is the final summary. You get question on anything. Listen my point. What I mean to say here. Please everyone understand. So in acidic medium, the acidic drugs remain in unionized form. That's why they are absorbed. In basic medium, the acidic drugs get ionized, and that's why they are excreted out of the body. In the reverse occurs for the basic drug. The basic drugs remain unionized in basic medium. That's why they are absorbed. And the basic drugs become ionized, more and more ionized in acidic medium. That's why they are excreted. So this is the final verdict. This is the final verdict. There are 4 golden rules. What are the 4 golden rules? Don't learn the summary, learn the golden rules. 4 golden rules. What are the 4 golden rules? Who will tell me? Tell me the golden rules. Unionized form का क्या होता है? Ionized form का क्या होता है? Absorption के लिए कौन सा medium लगता है? Excretion के लिए कौन सा medium लगता है? The 4 golden rules. The unionized form is always absorbed. है ना? It is absorbed, it is complete, and ionized is broken one, so it is excreted. For absorption, same medium is required, and for excretion, opposite medium is required. This is the summary. जिसको समझ में आया अच्छी बात है, जिसको नहीं समझ में आया, don't worry. If you don't understand, it's also good. Just learn it. Just learn it. Examiner is not judging whether you got the concept and you are doing rectification. It doesn't matter. But the thing is that you should know these 4 golden rules. By understanding or by rectification, howsoever, you should know these 4 golden rules. If you know these 4 golden rules, you will not do any mistake in these questions, the pH related questions. Everyone give me a thumbs up, say yes if you got it, and we will proceed. Keep interacting, come on. Can we proceed? Huh? So now try solving this question. I guess you will be able to solve. Okay, how to make urine acidic or basic? We can make the urine acidic or basic. Let me show you. Yes. So this you already understood. This you already understood, say. So what is the site of absorption? Acidic drugs are absorbed from acidic medium, that is stomach. Basic drugs are absorbed from basic medium, that is intestine. This is regarding absorption. Excretion के लिए opposite medium is required. Acidic drugs are excreted in basic urine and basic drugs are excreted in acidified urine, right? So this is for excretion. So how to acidify the urine or alkaline the urine? If you want to make the urine alkaline, if you want to make the urine basic for excretion of acidic drug, just give IV infusion of sodium bicarb. Sodium bicarb, है ना? NaHCO3. Sodium bicarb का IV drip लगा दो. Urine will automatically become basic and acidic drug will be excreted out of the body, है ना? And if you want to acidify the urine, give IV infusion of arginine hydrochloride, followed by ammonium chloride, NH4Cl, right? So now read your question and tell me the correct answer. You can do so, I guess. Let me come on the question again. This is the question in front of you. Can you please try? How many of you can try this question so we can move on the next concept? Now on this concept you get many questions, believe me. What is the best way to manage the patient present with aspirin poisoning? The first catch in the question, aspirin is acidic or basic. So let me tell you, aspirin is an acidic drug, and it is a case of poisoning. So what do you want? You want absorption or excretion? So of course, in case of poisoning, we want excretion. So basically, the examiner is asking you how you excrete an acidic drug. So we know acidic drugs are excreted in basic medium, right? In basic medium. So how to basify the urine? Is it sodium ammonium chloride or sodium bicarb? So of course the correct answer is sodium bicarb. You all can do it now. You all can do it. Okay. Okay. Can we go ahead? Can we go ahead? Okay. Let's come on the next question. So few more questions on this concept if you want. 2-3 more questions. I will not give any explanation, just question and answer. And then we will move on the next concept. Read the question. Tell me the answer. Tell me acidic drug is more ionized at which medium? In which medium? Basic medium, acidic medium, neutral medium or none? I'm asking you the question. Acidic drug is more ionized at. Don't learn the question like that. Ionized form is absorbed or excreted. Ionized matlab toota hua. So it is absorbed or excreted. So it is excreted out of the body. Now read the question. Acidic drugs are excreted in which medium? So basically the examiner is asking you the acidic drug is excreted in which medium? So I told you for excretion opposite medium is required. They are asking for acidic drug. Go with alkaline. So correct answer is alkaline. This is the approach, and same reverse question we can frame for basic drugs, right? Now one more question about acidic drug. One of the following is true. What is true about acidic drug? Acidic drug. So acidic drugs are best absorbed in acidic medium? I don't think so. I'm sorry. Yes, this is correct. Acidic drugs are best absorbed in acidic medium, the same medium. Acidic drugs are best absorbed in alkaline medium? No, I don't think so. Excretion के लिए opposite medium is required. Not absorbed in acidic medium, ये भी गलत है. And it binds to alpha glycoprotein? No. Acidic drugs are bind to albumin. The basic drugs bind to alpha glycoprotein. So this is also wrong. So among them, again, A is correct. So this is the approach towards the question. Last question on this concept and we will move to the next concept. Okay, today I want to give you as many as 30-40 concepts in entire pharmacology. The ultra important topics. Jinse question short hai. Now which question will come, I don't know. But from these topics, definitely questions are going to come in your exam. Okay. The next concept is acetyl salicylate and phenobarbital. They are better absorbed from the stomach. Why? Examiner is telling you, वो पूछ नहीं रहा है, examiner बता रहा है कि ये दोनों जो drug है ना, ये stomach में से absorb होती हैं. क्यों भाई? ये दोनों stomach में से क्यों absorb होती हैं? Why? Why these drugs are absorbed in stomach, not in intestine? Why? First tell me, what are these two drugs? Are these acidic drugs or basic drugs? Common sense, they are absorbing from stomach, that is acidic medium. So they are acidic drugs. So these are weak acids, not strong acids, not bases. These are weak acids. So answer is from A and B, not from C and D. ठीक है, पहले तो दो ऑप्शन हटा दो. ठीक है. Now why they are absorbed in gastric pH only? They remain non-ionic or they remain ionic in that medium? So you tell me for absorption. The question is regarding absorption, not excretion. So absorption के लिए कौन सा फॉर्म चाहिए? Unionized या ionized? Complete या broken? So my concept is very clear. For absorption, I want unionized form, non-ionic form, right? So correct answer here is A. So this is the approach towards the question. At the first look, the question may look very difficult to you. The question is like very simple if you know the concept. Okay, so let's move ahead. Let's come on the next concept. The next concept, all of the following are prodrug except. Now in pharmacology, I am having 40 mnemonics, 40 different mnemonics with different drugs. Hannah, you have to learn all the mnemonics together. So if you wish, I can share the PDF of entire mnemonics at one place. So how many of you know the mnemonics of prodrugs? How many are prodrugs? उससे पहले prodrug होता क्या है वो पता है क्या? What is a prodrug? Is it as all of the following are prodrug except aspirin, levodopa, 𝗙𝗵𝗲𝗃, captopril. What is the correct answer? Can you give a guess? Yes, you are right. KPS, you are right. Andrew, you are also right. So most of the students are right and you all are saying D as the correct answer. Let me explain you everything about prodrug. क्या होता है prodrug? Again, this is my basic diagram. This is my master diagram in which I am going to cover entire general pharmacology, pharmacokinetics as well as dynamics. ठीक है, चलो, listen. Imagine this is a person who is taking an oral drug. The person is having headache, the person is having migraine. For that, the person is taking a drug by oral route. So drug will go in the mouth, it will go in the esophagus, it will go in the stomach and the intestine. Now if it is an acidic drug, it will absorb from the stomach. If it is a basic drug, it is absorbed from the intestine. You can understand it. Finally, the drug reached in the blood, right? Now what I am supposed to do? The absorption is over. The drug is already absorbed. Absorption is over. Okay. After absorption, I am assuming this drug should go to its site of action. If this drug is taken for headache, it should go to CNS parenchyma. If it is taken for heart failure, it should go to the heart. Taken for diarrhea, it should go to the intestine. Whatever purpose it is taken, the receptors are present in that organ. The drug should go to that organ and show its mechanism of action and treat the disease. I'm assuming that, but there is a problem. The problem is that this drug is inactive. This drug is inactive. So first we have to activate the drug, then it can show its mechanism of action. For activation, the drug will go in liver. The drug will go in liver. In the liver, there are certain enzymes which convert inactive drug to active form. So these drugs which are inactive outside the body, these are inactive outside the body. So once they are taken, they will go in the liver, and in the liver they convert from inactive to active. Then they again come in the blood, and from the blood then they go to their site of action. These are known as prodrug. These are known as prodrugs. Got it? These are known as prodrugs. Got it? Can we go ahead? Okay. Okay. So these are known as prodrugs. So Vineet, I am coming to your query. Let me finish this. So so give me the list of these drugs. So there is a list. I am having a mnemonic for you for this. So let me read the mnemonic for you. All prefer doing MD in clinical subjects. Of course, everyone wants to do MD in medicine, surgery, OBG, है ना? Clinical subjects सबको अच्छे लगते हैं. So this is a mnemonic for the prodrugs. All का A stands for ACE inhibitors. You know, all ACE inhibitors are have a suffix of pril, है ना? There are many prils. All the ACE inhibitors are prodrugs except two, captopril and lisinopril. ये pril है, ये ACE inhibitor है, फिर भी prodrug नहीं है. Apart from that, any pril is a prodrug. So learn the two exceptions. जो हमारा question था अभी, it was based on exception. Prefer का जो P है, depends on three drugs. Prednisolone, proton pump inhibitor, and proguanil. ठीक है. Doing का जो D है, 𝗙𝗵𝗲𝗃. One of the option was 𝗙𝗵𝗃, if you mind, है ना. M जो है again it represent three drug. Mercaptopurin, methyl dopa, and minoxidil. ठीक है. Again one more D. One D तो 𝗙𝗵𝗃 था. Another D is dopa. लीवोडोपा का डोपा. वन ऑफ द ऑप्शन वाज लीवोडोपा. ठीक है. इनका जो आई है ये इरिनोटिकान. सी जो है ये साइक्लोफॉस्फामाइड, क्लोपिडोग्रिल एंड कार्बामेजोल. एंड एस जो है सब्जेक्ट्स का ये सल्फासालाजन. यू विल से मैम हाउ आई लर्न दिस, इज अ बिग लिस्ट. So there is no way, you have to learn, है ना. With the mnemonic at least you are able to learn. If I don't give the mnemonic and give you only list, you are unable to learn. But with the mnemonic at least there is a chance. If you read it twice, thrice and 4-5 times now, you can learn it. Say it sometimes with your friends, say it out, write it down somewhere, it will fit in your memory. So these all are prodrugs. These are inactive. After going in the body, they convert into active form. So have a look. So now have a look on your options, right? So in your options, you can see one of the option is captopril, which is an exception. It is not, it is an ACE inhibitor, yet it is an exception. It is not a prodrug. Got it? Everyone got it? Can I go ahead? Now what Vineet is asking, aspirin better absorbed in ionic form. Ma'am, no, Vineet. So let me come on last question. You are confused in this question. Any drug, Vineet, any drug, है ना, acidic हो या basic हो. Just take example of acidic drug AH, है ना. It will ionize as A positive and it will ionize as H positive and A negative. H positive and A negative. Got it? This is the ionization, है ना. AH यहाँ इसको better to write HA. Better to write as HA. HCl. I always consider HCl, HNO3 like that. Any acidic drug, है ना. So this form is known as unionized form, that is complete, है ना. And this form of the drug, A दो जगह है, A यहाँ पे भी है विनीत, A यहाँ पे भी है. This is unionized form of the drug and this is ionized. You can see इसके ऊपर ion है. So this is incomplete one, ionized. I learned like that. So body always prefer to absorb the unionized one. Complete वाला body को अच्छा लगता है, उसको retain करती है body. Always body absorb and retain the unionized one. जो ionized है वो तो already टूटा हुआ है. It's an ion. It's not good. So body excrete that. It's a golden rule. It's a golden rule I told you. Now read the option and tell me. So here you understood that these drugs are acidic drugs. So of course these are weak acids and they are absorbed in non-ionic form, not in ionic form. Ionic form में कभी absorb नहीं होगी. हाँ, excrete के लिए question होता. If I change the question from absorption to excretion now, Vineet, then the answer will become B. Now give me a thumbs up if you got your query to be cleared. These are very confusing topics, but I'm telling the golden rules. Learn the golden rules. 4 golden rule learn कर लो. PH वाला कोई भी question गलत नहीं होगा. मेरी guarantee. कुछ भी question आ जाए, कुछ भी. The 4 golden rules should be at the tip of your tongue. You got it? The one who was asking the query. Can we go ahead on the next question? You were asking the same query which I have explained you. Can we go ahead? The next question is in front of you. The next question is based on the metabolism now. Okay, all the drugs are metabolized by acetylation except. So which of the following drug is not metabolized by acetylation? Is it phenytoin, isoniazid, procainamide, or hydrolazine? So what is the correct answer? What is the correct answer? You have to understand the metabolism now. So can you give a guess? What is the correct answer here? Huh? which drug is not metabolized by acetylation? They are asking except. Again, I will give you new mnemonic for the drugs to be metabolized by acetylation. Before that, you have to understand the concept of metabolism. कोई भी question आ जाए metabolism से, you should be able to solve that. Say yes or no. You should be able to solve that. So let me tell you, here the correct answer is phenytoin. Don't learn the answer. I will come on the question again. Let me explain you metabolism. Chalo. Let me show you the master diagram. Is diagram के बिना तो कुछ नहीं होगा. You have to understand this diagram. Okay, again, the person is having headache. The person is taking the drug for that via oral route. Drug is going in mouth, esophagus, stomach, intestine. Acidic drugs absorbed from stomach. Basic drugs absorbed from intestine. Ultimately, drug reached in the blood. From the blood, drug is going to its site of action in the brain, showing its mechanism of action, curing the disease. Right? Now I want to excrete the drug. Drug has already shown its action. No need in the body. Let's excrete it in the urine. Right? But the problem is that the drug is non-polar. I asked the kidney, can you excrete this? Kidney is saying, no, I cannot excrete non-polar drug because in me the urine is formed. Urine is water. Urine is liquid. And in water, in liquid, polar drugs are absorbed. Polar drugs are dissolved. And non-polar drugs cannot be dissolved. Without dissolving, how can I excrete? So kindly make it polar. If you can make it polar, I will excrete it. So we are going to the liver, requesting the liver. Liver, can you convert non-polar drug to polar? Because this drug has already done its job. If you can convert this, it will be excreted out of the body. So inside the liver, there is a cell hepatocyte. Inside the hepatocyte, there is an enzyme. These enzymes can do this conversion, and they are saying, yes, please give the drug inside us. Inside the hepatocyte, the name of the enzyme is cytochrome, CYP, cytochrome 450, cytochrome P450. This is the name of the enzyme. It is present in the microsome of this hepatocyte. So this enzyme will convert the non-polar drug to polar drug, and this is known as metabolism. So before excretion, after mechanism of action and before excretion, we want metabolism. In metabolism, basically we are converting the non-polar drug to polar drug so that it can get excreted ultimately from the urine. This is the purpose. And this is done by the enzymes present in the hepatocyte of the liver. Right, you got it. And this is known as metabolism. So how does liver do so? How does liver do so? So there are two types of metabolism, phase 1 and phase 2. In phase 1, how it convert the non-polar drug to polar? There are two forms. If I want to convert a non-polar drug to polar drug, there are two methods. Let me draw a non-polar drug. For example, this is a non-polar drug. I want to convert it into polar form now. So I can expose certain functional groups like hydroxyl group, ammonia group, certain groups in that. So this is known as phase 1. Or else, the second way, I can conjugate it. I can conjugate this non-polar drug to some polar compound, endogenous polar compound of the body. This is polar. This is non-polar. So ultimately, the combo will become polar, right? So we are conjugating here. So this is known as phase 2 or conjugation. So either we are exposing the functional group, that is phase 1, or we are conjugating it with a polar. So this is non-polar, this is polar, but the ultimate product will become polar. So in this way, we are converting a non-polar drug to polar. This is phase 1 metabolization, this is phase 2 metabolization. There are 5 types in the phase 1 metabolization, and there are 6 types in phase 2. In phase 2, we require another compound, that is should be a polar compound that should bind with the drug and do the conjugation. So phase 2 is always conjugation. And phase 2, we are exposing some functional group present in the drug only so that it converts from non-polar to polar. It is known as functionalization. Did you got it? Are you getting the concept? So phase 1, phase 2. Phase 1 is functionalization, phase 2 is conjugation. Phase 1 is of 5 types: oxidation, reduction, hydrolysis, cyclization, decyclization. So we will do 5 types phase 1. Phase 2 is of 6 types depending on the compound. As I told you, this is a non-polar drug. I want to make it polar. How should I do it? Combine it with some polar compound. What is that polar compound? So that the complete combo will become polar. So this is a way. This is known as conjugation. So what is the second compound with which I am conjugating the drug? If it is glucuronide, it is glucuronide conjugation. It is glycine, it is known as glycine conjugation. If it is glutathione, it is glutathione conjugation. It can be sulfate, it can be methyl, and it can be acetyl. Just my question hai abhi. My question is on acetylation. So learn GGGSMA, the 6 types of conjugation. Glutathione, glycine, glucuronide, sulfide, methyl, and acetyl. So maximum question comes from acetylation. So this is an overview. So acetylation कौन-कौन सी drugs में होता है? Which all drugs show the acetylation? So there is a mnemonic. The mnemonic is 𝗲𝗵 ABC. What is the mnemonic? The mnemonic is 𝗲𝗵 ABC. So let me tell you the full form. C is clonazepam. You know clonazepam is a sedative used as a tranquilizer for inducing sleep. ठीक है? C. H is hydralazine. You know hydralazine is an antihypertensive drug. Okay. I is isoniazid. We all know it's a anti-TB drug. used in the DOTS treatment. P is procainamide. It is an antiarrhythmic drug. S is a sulfonamide. It's an antibiotic, right? A, B, C. A is 𝗏𝑆-butalol. It is one of the beta blocker. Ambrinon, and B is benzacaine, and C is caffeine. So please learn. I know it's difficult to learn, but I'm giving you the mnemonic. So this is a mnemonic of acetylation. Now please apply this mnemonic 𝗲𝗵𝐶 on your question and tell me the answer. So which of the following drug is not metabolized by acetylation? So the mnemonic I told you is 𝗲𝗵𝐶. Never forget, 𝗲𝗵𝐶 से acetylation होता है. Acetylation 𝗲𝗵𝐶 में होता है. So in this I is coming as a isoniazid, P is coming as a procainamide, है ना, and H is coming as a hydrolysin. But this P is not phenytoin, P is procainamide. So correct answer is A. With the help of the mnemonic, you can give a try at least. At least try करोगे, लेकिन mnemonic ही नहीं पता होगा तो कैसे करोगे? So in pharmacology, the 40 mnemonics should be at the tip of your tongue. Without that, you cannot appear in your exam. Got it? Can we go ahead? Huh? Can we go ahead? Okay. So let's go ahead. Let's go ahead on the next question. The next question again, enzyme inhibitors and enzyme inducer पे पक्का एक question, पक्का, very frequently asked in your exam. All are enzyme inhibitors except, they're asking except, कौन enzyme inhibitor नहीं है? So first have a concept, you tell me what is the answer, then I will tell you enzyme inhibitor as well as inducer, दोनों बताऊंगी मैं. So first you tell me what is the correct answer here. Can anyone give a guess? Can anyone give a guess? What is the correct answer here? Yes, what is the correct answer? So yes, the correct answer here is carbamazepine. Again, I will come on the question. Okay, this is the mnemonic. So let me explain you the microsomal enzymes. As I told you here, in the liver, metabolism takes place. What is metabolism? Metabolism is conversion of non-polar drug to polar drug. We want to convert non-polar drug to polar drug so that it can be excreted out of the kidney very well. Because non-polar drugs cannot excrete it, only polar drugs get excreted. So this takes place in the liver. In the liver, there are hepatocytes. Inside the hepatocytes, there are enzymes. So let me zoom this portion for you. Let me zoom this portion on the next page. See, this is liver. Can you all see? I want to explain you the enzyme inhibition and enzyme induction. What do you mean by that? So you all can see this is a liver. Inside the liver, appreciate the hepatocyte. Appreciate the hepatocyte. Inside the hepatocyte, appreciate the endoplasmic reticulum, inside which this is the enzyme. Can you see this purple color enzyme? This is the enzyme. This is cytochrome P450. Okay, cytochrome P450 enzyme. So this enzyme converts non-polar drug to polar drug. You will say, ma'am, then what is the problem? What do you mean by induction, inhibition? What do you mean by that? Okay, imagine I was having only one drug. The patient was taking only one drug for one disease, right? So this drug A was the drug, main drug. Okay, so drug A was going in the body, getting absorbed, showing its action. Now the drug want to get excreted. So drug is going in the liver. This hepatocyte, this enzyme, convert this drug A to non. So see, drug A is coming and binding here. So this enzyme convert drug A from non-polar to polar. The things was very easy and drug A was excreted out of the body. There was no problem in that. But do we give only one drug to one patient? Sometimes patient complains of multiple things. Doctor, I'm having fever also. Doctor, I'm having acidity also. I'm having this also, that. You give antibiotic also. You give paracetamol also. You give anti-acidity drug, some PPI also. You are giving multiple drugs, a combo, a cocktail of drug. Imagine you are giving one more drug, drug B, right? Drug B is inhibiting this enzyme. See, minus matlab inhibiting. So this enzyme become non-functional. So what will happen now? This enzyme become non-functional, so it will not convert drug A from non-polar to polar. So drug A will remain as non-polar only. It cannot be excreted out of the body. So drug A will cause the toxicity because it cannot be excreted out of the body. It will remain in the blood only. It cannot be excreted because it cannot convert from non-polar to polar. So in such scenario, whenever this drug is known as inhibitor. Drug B is an inhibitor drug. Inhibitor, and drug A is the parent drug or substrate drug. This is substrate drug. So inhibitor drug, when you are giving combo of two, so I will give you a list of which two drugs cannot be given together. The substrate and the inhibitor, है ना? If you are giving the two, toxicity किसकी हो रही है? A की B की? Toxicity A की हो रही है. There is a toxicity of substrate drug if you are giving B together. You got my point? So here the drug A will have the toxicity. Because it cannot be excreted, it will remain in blood only. It cannot be excreted from non-polar to polar because the enzyme do so is inhibited by another drug. This is inhibition, right? I will give you the list. So this is the list of the substrate drug. Substrate drug is drug A, जिसकी toxicity हो रही है. The mnemonic is CT scan. CTSCAN. CT scan. C stands for cyclosporin. One more C, calcium channel blocker. ठीक है? T for tacrolimus. S for statins. Statins are the drugs which lower cholesterol. ठीक है? C. कैन का C again, it's 3 drug. CAT. You can learn C में CAT आ जाएगा. Cisapride, estimizole and terfenadine. A is amiodarone and N is 𝗬𝗏𝗃. It is a protease inhibitor used for anti-HIV drugs, right? So please learn the mnemonic. These are the substrate drugs. इनको किसके साथ नहीं देना है? Don't give them with drug B. These are drug B, है ना? That inhibit. These are enzyme inhibitors. ये enzyme को inhibit कर देंगे. इनके एंजाइम को इनहिबिट ये कर देंगे. तो ये वाली जो सबस्ट्रेट ड्रग है, दे कैन नॉट बी एक्सक्रीटेड आउट ऑफ द बॉडी एंड दे ऑल विल कॉज द टॉक्सिसिटी. सो नेवर गिव एनी ऑफ दिस ड्रग्स विद दीज ड्रग्स. यू शुड नो, बीइंग अ डॉक्टर यू शुड नो द कॉम्बो, द डेडली कॉम्बो, है ना? बीइंग अ डॉक्टर क्या करना है ये पता हो न पता हो, ये जरूर पता होना चाहिए कि क्या नहीं करना है. So you will not lose a patient. Got it my point? And you will not do the blunders in your practice. ठीक है? So never give these all drugs with these. What is the mnemonic? The mnemonic is vitamin K cannot cause enzyme inhibition. V stands for valproate. K stands for ketoconazole. It's an antifungal drug. है ना? Valproate, you know. Okay. C is cimetidine. One more C is ciproflox. E is erythromycin and I is INH. That is isoniazid, anti-TB drug. So never give CT scan with vitamin K cannot cause enzyme inhibition. Never give this combination together. Otherwise there is toxicity of these caused by these. Toxicity किसकी होगी? Substrate की होगी, inhibitor की नहीं होगी. So that is regarding the inhibition. उल्टा होगा induction में. Let me tell you again the two scenario. When we were giving drug A alone, there was no problem. The things were super simple. The drug A is showing its mechanism of action. Now going to the liver. Liver, can you convert me from non-polar to polar? I want to get excreted. Liver is saying yes. Come inside me. I will do the conversion. So here the enzyme is present. Cytochrome P450, that is doing the conversion. So it is getting converted from non-polar to polar, and getting excreted out of the body. The things were simple. But whenever we are giving two drugs together and the another drug B is an inducer, C plus sign, not minus. It is inducing this enzyme. So this enzyme become hyperactive. What do you mean by hyperactive? Last time inhibition हो रहा था. The last time it was inhibiting. This time it is inducing. So this enzyme become hyperactive, na? So before drug A show its action, it get metabolized. I want to do the metabolism of drug A. I want to convert it from non-polar to polar. But after it has shown its action, जब action complete हो जाए ना, so first I am taking the drug A by mouth. See, so drug A is going inside, getting absorbed. It is going to its site of action, showing its mechanism of action. After that, I want to convert it from non-polar to polar so that it get excreted. But here the enzyme get hyperactive by some another drug B. So this enzyme convert the drug from non-polar to polar to drug A before it shows its action. तो आप ड्रग ले भी रहे हो, कोई फायदा नहीं होगा. You got my point? So decrease intensity and decrease duration of action of the drug. In the inhibitors there was toxicity. In inducers it's opposite of toxicity. Toxicity का उल्टा हो रहा है. Decrease intensity and duration of the drug. Right? So you should know this deadly combo also. है ना? Substrate drugs are same. Here also it is CT scan. Substrate drug तो यहाँ भी CT scan है ना? CT scan. But never give CT scan with the inducers. What is the list of the inducer? The list of the inducer, there is a mnemonic. The mnemonic is GPRS cell phone battery dead. GPRS cell phone battery dead. What is the full form? G stands for 𝗲𝗏𝗃. It's an antifungal drug. P stands for phenytoin. ठीक है? R stands for rifampicin. S stands for smoking. C stands for carbamazepine. P stands for phenobarbital. One P phenobarbital ही one of the barbiturate है. So you can learn barbiturate ही तो है phenobarbital. And D is DDT. So GPRS cell phone battery dead. What we learned? Let me summarize. Can you please help me in the summary? We learned two type of drugs. What the two type of drugs? Enzyme inhibitors, ठीक है जी, है ना? Inhibitors and enzyme inducers, ठीक है ना? What they cause? They are inhibiting the enzyme cytochrome P450 and they are inducing the enzyme cytochrome P450. So here the drug A is same in both of them. We are giving separate list for drug B. Drug A is the parent drug, the substrate drug. That is same. That is CT scan. You should know the full form. CT scan का जो C है वो cat है. You should know the complete drug list. I am not saying it. Please learn the list. है ना? Now if you give these substrate drug with inhibitors, drug A की हो जाएगी toxicity. And if you give drug A with inducers, इसकी हो जाएगी decrease intensity. Toxicity का उल्टा. Decrease intensity and decrease duration. Duration और intensity दोनों ये अपना action है. It cannot show its mechanism of action because its concentration falls very frequently. So never give drug A with inhibitors also, inducers also. So give me the list of inhibitors and inducers. Inhibitors की क्या list है? Vitamin K cannot cause enzyme inhibition. Try to say the full form. Vitamin K cannot cause enzyme inhibition. Vitamin K cannot cause enzyme inhibition. And what is the list of inducers? GPRS cell phone battery dead. Try to say the full form. So my point is that never give CT scan either with vitamin K cannot cause enzyme inhibition, otherwise इन लोगों की toxicity हो जाएगी. और never give CT scan with GPRS cell phone battery dead, otherwise इन्हीं drugs का intensity और duration of action कम हो जाएगा. This is the real meaning of inhibition and induction. How many of you got it? Can you write something in the chat box that either you got it, you didn't got it? How do you like this topic? You got my point? You get many questions from that. Not only on the list, you should know the mnemonic. The 3 mnemonic are in front of you. The mnemonic of the substrate drug, the parent drug, है ना? The mnemonic of the enzyme inhibitors and the mnemonic of the enzyme inducers. Inhibitors causes toxicity of the parent drug, okay? And inducers causes reduced intensity and reduced duration of action, okay? Reduced intensity and duration of action of the parent drug. So main है parent drug, that is common for both of them, that is CT scan. So toxicity या reduced action वो होगा किसका? parent drug का. अगर पेरेंट ड्रग को इनके साथ दिया तो टॉक्सिसिटी हो जाएगी इन लोगों की, और पेरेंट ड्रग को इन लोगों के साथ दिया तो उसका एक्शन ही नहीं होगा, है ना? सो नेवर गिव पेरेंट ड्रग विद दीज एज वेल एज दीज. लर्न दीज द डेडली कॉम्बिनेशन. दिस कॉम्बिनेशन इज डेडली, दिस कॉम्बिनेशन इज ऑल्सो डेडली. नेवर डू दिस कॉम्बिनेशन. बीइंग अ डॉक्टर यू शुड नो दैट कि क्या नहीं करना है. गिव मी अ थम्स अप यार, कम ऑन, अप्रिशिएट माय एफर्ट्स, से समथिंग. आई एम ट्राइंग हार्ड टू एक्सप्लेन यू. ओके, यू गॉट इट? So have a look on the question. इन सब के अलावा एक तीसरा मैकेनिज्म और है ना? Sometime what happens ना, listen, this is a drug. So you are taking a drug by mouth. The drug is going inside, getting absorbed. After getting absorbed, it is reaching in the blood, right? Now this drug is going to its target organ, showing its mechanism of action. Now it want to get excreted, but again the problem is same, it's non-polar. But the drug do not want to take the help of liver. Drug is very, you can say, self-dependent, egoistic, है ना? Drug do not want the help कि मुझे किसी का help नहीं चाहिए. I do not want the help of the liver to convert me from non-polar to polar. I do it myself, है ना? There are some people who are very egoistic. I will do it myself. So there are certain drugs which change their conformation in the blood only. They do not go to liver at all, है ना? उनकी लड़ाई है liver से. You can learn like that, ठीक है? They will change their conformation in the blood only by themselves, without the help of the enzyme. उनको cytochrome P450 पसंद ही नहीं है. बोलेंगे हम मर जाएंगे लेकिन cytochrome P450 का help नहीं लेंगे. So they will change their conformation by themselves and they get converted from non-polar to polar in the blood. This is non-enzymatic, without the help of the enzyme, and after that they get excreted from the kidney. Only one drug do so, that is atracurium. Atracurium की cytochrome P450 से लड़ाई है ना? ये खुद ही अपना change कर देती है. So it does the rearrangement, molecular level rearrangement in the blood itself spontaneously without the agency of cytochrome P450. It do not go to the liver. It do not take the help of the liver or cytochrome P450. This is known as Hoffman's elimination. Very commonly asked. Since it is shown only by one drug now, it is very commonly asked question in your exam. What is Hoffman elimination? You should know the definition also. You should have an understanding कि मतलब क्या है भाई और कौन सा ड्रग दिखाता है. So name of drug, the example is atracurium. Okay, got my point? Say yes if you got it, huh? So this is atracurium. So atracurium is a drug that converts from non-polar to polar in the blood only by doing some spontaneous molecular rearrangement without going in the liver, without taking help of enzyme. So that is known as Hoffman's elimination. I hope you got it. Now you want to solve that question again? Let me show you the question again. Let me go back. This is the question, right? So they are asking, now everyone can try. I want everyone to participate. They are asking enzyme inhibitors except. The list should be correct. The list is GPRS enzyme inhibitors. I'm sorry, I'm writing the wrong list, I guess. So the mnemonic is vitamin K cannot cause enzyme inhibition, है ना? These are inhibitors. But write the list of inducers also. GPRS cell phone battery dead, है ना? So which of the 4 option is not coming in this? I guess 𝗬𝗏 is coming. K, ketoconazole is coming, and there are 2 C's here. There are 2 C's, है ना? One is cimentidine, but other is ciproflox, not carbamazepine. The carbamazepine is ये है, cell phone का C है. So carbamazepine is enzyme inducer, not inhibitor. इसलिए मैंने दोनों mnemonic लिखे in front of you. You got it? So correct answer here is A. You should know the mnemonics very well. Few more questions on this. This is a very, very hot topic, huh? I mean very important, frequently asked questions on this topic. So see. Okay, let me go. One more question. Which of the following is an enzyme inducer? Apply the mnemonic. I guess question is very simple. Enzyme inducer they are asking. Enzyme inducer, not inhibitor. The enzyme inducer. So it's GPRS cell phone battery dead. So what is the correct answer? GPR ka R is rifampicin. So rifampicin is the correct answer. If you see the remaining 3 options, they are from opposite mnemonic. What is the another mnemonic? I mean the mnemonic of the inhibitor. The mnemonic of the inhibitor is vitamin K cannot cause enzyme inhibition. So you can see isoniazid भी वहाँ पे आ रहा है, Erythromycin is also coming there, and ketoconazole is also from opposite place. So just to confuse you, the other three options are from the enzyme inhibitors. Only one of them is enzyme inhibitors, so the two mnemonics at the tip of your tongue. If you don't know the full form of CT scan, it's okay. Nobody is going to ask you the parent drug. They are more interested in asking you the inhibitors and the inducer. You should know these two lists. But the toxicity and this thing, reduced intensity is taking place of the parent drug. I hope it's crystal clear. One more question in front of you, which is the cytochrome P450 inhibitor. Can you please try? Cytochrome P450 inhibitor I am asking. So which of the following is a cytochrome P450 inhibitor? Apply the mnemonic inhibitor ka. Inhibitor ka kya hai mnemonic? Again, vitamin K cannot cause enzyme inhibition. So what is the correct answer? So K for ketoconazole, and I'm not writing the opposite mnemonic. The other three options are from opposite mnemonic. The questions are very simple, hai na? One more last question in front of you. Hoffman's elimination is what? What do you mean by Hoffman's elimination? Can you read the option and tell me the correct answer? Is it inactivation of the drug by metabolizing enzyme? Is it unchanged excretion by the kidney? Is it excretion in feces? Or is it inactivation of the drug by molecular rearrangement? The question is very simple. I explained you what is Hoffman's elimination, and only one drug that shows that. So what is the correct answer? Give a guess, a wild guess. Yes, I'm waiting for the reply. So yes, the correct answer here is D. It is the inactivation of the drug by molecular rearrangement. The drugs are very egoistic. They do not take the help of the liver. They do not go to the liver. They do not go to cytochrome P450 and get converted from non-polar to polar. They just do it by themselves. And the name of the drug is 𝗏𝗃, and you all are right. The correct answer is D. So sometimes they ask you a question on the Hoffman's elimination kya hota hai. Sometimes they ask you kaun dikhata hai. So 𝗏𝗃 is the drug, right? So let's come on the next topic, order of kinetics. You frequently get question on order of kinetics, and students don't have a concept of this. I guess this is the last question from the general, then we will move on the systemic, I guess. Okay, so let's start it. What is zero order kinetics? What is true about zero order kinetics? There are two order of kinetics, 0 and 1. I will explain you everything very clearly. So here rate of elimination is independent of plasma concentration, or rate of elimination is dependent on plasma concentration. Or is it clearance is always constant, or 𝗕 is constant? So of course, if you use your common sense, A and B both cannot be correct. So दोनों में से कोई एक ही सही होगा. या तो rate of elimination independent होगा, या तो rate of elimination dependent होगा. So even if you don't know the concept behind that, you should be able to say कि मैम आंसर तो A और B में से कोई एक होगा, क्योंकि दोनों these are mutually exclusive ना, दोनों साथ में नहीं हो सकता. So what is the correct answer? Is it A or B? The correct answer is A. Let me explain you. So here I am concerned about excretion now. We have seen the absorption में हमने pH का mechanism देख लिया. We have seen distribution, हमने पूरा metabolism भी देख लिया. Now it's time to see the excretion. ठीक है? I want to excrete the drug. We have taken a drug. The drug is already going inside. It got absorbed from the stomach and intestine. It's already distributed to its site of action, show its mechanism of action. In the liver, it's already converted from non-polar to polar. Everything is done. Now it's time to excrete the drug. Right? For excretion, we have to see the order of kinetics, right? There are two order of kinetics. In the chemistry, in your childhood, whenever you were in 7th or 8th standard, you may have read this formula. I guess everyone knows that. The rate of elimination is directly proportional to plasma concentration to the power order. The rate of elimination is directly proportional to plasma concentration to the power. Power mein hai order of reaction. First of all, learn this formula. You will say, ma'am, learn, but samajh mein kuch nahi aa raha. Don't worry, I will explain you. Just understand. I will make you understand. Just learn this formula. So see this diagram. There are two order of kinetics. Most of the drugs follow. There are many order of kinetics, I mean, but most of the drugs, 99% of the drugs followed one of the two order of kinetics, either zero order or first order. So I will make you understand what do you mean. See, this is a kidney. This is an organ of excretion. I mean, you can see this is a kidney, the organ of excretion. So this is the afferent arteriole coming inside the kidney, taking the drug. And this is the efferent arteriole taking the blood away from the kidney. And here the urine is formed. Right? So some substrate get filtered. The glomerular filtration is there. The substrate get filtered and get out in the urine. So you can see, just suppose plasma concentration of any drug. For an example, it's 10 milligram per ml. For example, it's 10. है ना? So in the plasma, what is the concentration of the drug? It can be anything. For example, I'm making you understand. For example, plasma में कितना drug है? Plasma मतलब blood. Blood में कितना drug है? 10 milligram per ml. है ना? So whenever it will go to the kidney, it is a polar drug. The kidney will excrete it. है ना? So kidney कितना excrete कर रही है? In 1 minute, kidney is excreting 1 milligram. In 1 minute, kidney is excreting every minute at the GFR, na? Glomerular filtration rate. So in 1 minute, kidney is excreting, for example, 1 milligram. This is known as rate of elimination. This is plasma concentration. This is rate of elimination. PC and R. Okay. And here, the purified blood is going here. So whatever remaining drug, hai na? So in 1 minute, 10 में से 1 चला गया तो बचा 9, इन नेक्स्ट मिनट फिर वो 8 हो जाएगा, इन नेक्स्ट मिनट वो 7, लाइकवाइज ग्रेजुअली द ड्रग विल गेट एक्सक्रीटेड. आई गेस यू गॉट माई पॉइंट, है ना. लेट मी आस्क यू वन क्वेश्चन. So here the plasma concentration is 10, so rate of elimination is 1. Okay, you all can see it is an example, don't learn the values. Instead of 10, what if the plasma concentration is 100? What is the rate of elimination in that case? I'm increasing it 10 times, है ना. प्लाज्मा में ज़्यादा ड्रग प्रेजेंट है तो किडनी क्या फास्ट एक्सक्रीट करेगी. इफ द प्लाज्मा ड्रग इज मोर, इंस्टेड ऑफ 100 इट इज 1000, है ना. देयर इज लॉट्स ऑफ ड्रग इन द प्लाज्मा, lots of drug in the blood. Does the kidney will do fast excretion or same excretion? My question to you. So here I am increasing 10 times, 100 times. So will the rate of elimination will increase or remain same? What is the effect on rate of elimination of plasma concentration? Your answer should be, ma'am, what is the order of kinetics this drug follow? Different drugs follow different order of kinetics. Does it follow zero order? My answer will be different. Does it follow first order? My answer will be different. Right? So if you say one by one we will take the two scenario. If it is a zero order na, zero order में kidney is areal, in Hindi I say areal, है ना. So whether the concentration is 10, 100, 1000, 10,000, 1 lakh, भाई कुछ भी है, kidney तो 1 ही excrete करेगी, 1 milligram per minute, है ना. It will not change, it will not change. My point is that in zero order, the rate of elimination doesn't depend on plasma concentration. Say yes. You got my point. Rate of elimination doesn't depend on whatever is the plasma concentration, whatever minimum or maximum, kidney will excrete the same amount. Kidney will excrete the same amount of drug. The rate of elimination. So what is the formula I told you to learn? अभी बोलना ना मैंने एक formula learn करो, rectification. Rate of elimination is equal to plasma concentration to the power order of kinetics. Okay. So rate of elimination is equal to plasma concentration to the power 0. We are talking zero order na. So anything to the power 0 is 1. So rate of elimination is 1. That is the meaning of constant rate of elimination. है it is proven. यहाँ पे rate of elimination constant है. It doesn't depend on plasma concentration. Whatever is the plasma concentration, ये तो same ही रहेगा. Same amount is excreted always, always, always. Same amount is excreted always, right? So these drugs are dangerous now. Imagine you are asking the person to take 10 milligram per ml. उसके हिसाब से आपने डोजिंग दिया पेशेंट को, है ना. So patient is taking, लेकिन कई बार होता है ना, patient is not getting the response, patient को फायदा नहीं हो रहा. So without asking you, they just double the dose. कि ठीक है ना, डोज डबल कर लो, क्या फर्क पड़ता है. So they are just double or they are increasing. So instead of 10, they are taking 100 or 1000. If they do so kidney तो excrete 1 ही करेगा and they will have severe toxicity. So these are danger drugs, है ना. These are danger drugs. I will give you the mnemonic for that. So these are the zero order. Here rate of elimination is constant and a constant amount of drug is eliminated. It doesn't depend on plasma concentration. And what about the first order? First order में क्या होगा? If you are increasing the plasma concentration from 10 to 100, 100 to 1000, so if you are increasing 10 times, the rate of elimination also increases 10 times, है ना. जब ये 10 है तो ये 1 है, जब ये 100 है तो ये 10 है, और जब ये 1000 हो जाएगा तो ये 100 हो जाएगा. So whatever times you are increasing, that times rate of elimination also increases. Got my point? So apply the formula. What is the formula? Rate of elimination is equal to plasma concentration to the power order. Order is 1 here. So rate of elimination is equal to plasma concentration to the power 1. I mean to say rate of elimination is directly proportional to plasma concentration. It's power 1. So if you increase the plasma concentration, rate of elimination also increases that proportion only, 10 times, 100 times, whatever, है ना. So if you increase the concentration, kidney will excrete more, so there is no chance of this drug will have toxicity. So I can say these drugs are safe. The first order drugs are safe. And here I can say a constant fraction is excreted. I am not saying the constant amount. Please mind my words. I am saying constant fraction. Constant fraction means 1/10 of the drug is excreted. When the concentration is 10, 1 is excreted. When the concentration is 100, 10 is excreted. When the concentration is 1000, 100 is excreted. 1/10 is excreted. Always 1/10. So constant fraction is excreted. Say yes if you got it, everyone. So we have learned there are two types of drugs. Some drugs follow zero order of kinetics. Some drugs follow first order kinetics. There are two types of drugs. So here rate of elimination is constant. It does not depend on plasma concentration. Here rate of elimination directly proportional to plasma concentration. Here a constant amount of drug is always excreted. It always 1 kidney areal है ना. And here constant fraction is excreted, है ना. Always 1/10, है ना. Plasma में 10 है तो 1 excrete होगा, 100 है तो 10 excrete होगा, 1000 है तो 100 excrete होगा, like that, है ना. So that is the thing. Please understand the concept very well. Did you got it? Say yes if you got it. Say yes if you got it. Do you have any confusion in that? So which drugs are safe? Just a second, let me open your chat. So which drugs are safe? These are dangerous drugs. They cause toxicity, and these are safe drugs. So you should know which drugs are zero order kinetics, because these are dangerous. No, they can cause the toxicity. So we have learned the zero order and first order very well, right? You can understand it. Now I'm not explaining again the zero order and first order. I have explained you, right? So zero order की कितनी drugs होती हैं? So zero order का mnemonic है watt power. 0 watt power you can learn. There is a bulb होता है ना, watt, कितने watt का bulb है? So watt power is the mnemonic. W stands for warfarin. A stands for alcohol and aspirin both. Please learn. There are 2T. There are 2A and 2T. The 2T is 𝗬𝗃𝗃 and tolbutamide. And power का जो P है ये phenytoin है. तो WATT मतलब वॉट, AA कर दो उसको, WAAT एंड वॉट पावर. तो वारफेरिन, एस्पिरिन, अल्कोहल, टॉल्ब्यूटामाइड, थियोफाइलिन एंड फेनिटोइन, ये सब की सब, these all drugs follow zero order kinetics. That's why there is high chance of becoming toxicity. तो जब भी ये drugs आप किसी patient को दोगे, whenever you will give these drugs, any of these drugs to any patient, you should ask the patient, you have to be dose specific. अपने मन से dose कम ज़्यादा मत करना. Don't increase the dose with your wish. First take my consultation whether you can do so or not, because these are very dangerous drugs. If you increase the plasma concentration, excretion remains same. Excretion will not increase according to that proportion, and you will have toxicity and you can have various side effects for that, right? So please warn the patient, don't change the dose. These are dangerous drugs. What is the mnemonic? WAAT, watt power. Please say the full form. That is zero order kinetics. Remaining all are first order. Don't learn the list. Remaining all. So zero order is dangerous. That is the meaning. Got it? Say yes. Can we go to the next question? This concept is crystal clear to you. So yes, very good, Radheshyam, very good, Noor. Everyone is right. Okay. So coming on the next question. The next question is on next concept. Patients are first enrolled in which phase of clinical trial? You know, whenever any new drug is discovered, imagine I am a scientist and I have discovered a new drug for some disease, say for malaria, for HIV, for TB, any. I'm a discoverer, I'm a scientist, and I'm challenging this drug is best and it is more effective and having less side effects as compared to already existing drugs for this disease in the market, as compared to the competitive drugs. My drug is the best. So I'm challenging that. So can I launch it directly in the market? Will the government will allow me to launch that in the market? No, I cannot do this. So I have to do a clinical trial. And there are 4 phases in the clinical trial. Rather, there are 5 phases. Phase 0, 1, 2, 3 and 4. So when patients are enrolled first time, that is the question. What is the correct answer? So let me come on the solution. The correct answer here is phase 2. Let me explain you. So there are 4 phases as I told you now. Phase 0 is also micro phasing. So phase 1, 2, 3, 4. In phase 1 we take the healthy volunteers. है ना, phase 1 healthy लोगों पे करते हैं, healthy volunteers. These are volunteers, है ना. It is a open label trial. Anyone can participate. It's a volunteer, purely their wish. Like for COVID vaccine, we have discovered new vaccine for the COVID. It was very risky. No one was knowing what is the effect, what is the side effect. So many volunteers from the country came forward that yes, we want to volunteer in this trial. We know that side effect can be there, anything can happen to us, but yeah, we want to volunteer. And these are the healthy ones. These are not patients. So we are doing so just to see the safety and tolerability of the drug. So just to see the safety of the drug we are doing so, and we have to conduct it for 1 to 2 years. And success rate is 50%. That is phase 1. In phase 2, we first time introduce patient. That was my question right now. Patients are first time introduced. Word patient. So we do it on patients for that particular disease. If my drug is for TB, I will take TB patients. The first one was just volunteer. This is just to see the efficacy and dosing of the drug. The first phase 1 में we just see the safety कि भाई safe है कि नहीं. ऐसा नहीं देते से person get dead, ऐसा तो नहीं है ना. So in safe, ये safe तो है. We have proven that it's safe. The person are not dying. Now we will see its efficacy, that in disease whether they are effective or not. I am giving it for TB, whether it is curing TB or not. I am giving it for HIV, for malaria, whatever. So whether it is curing that disease, effective in that disease or not. And what is the dose ranging? In adults, what is the dose? In pediatric, what is the dose? In elderly, what is the dose? In pregnancy, what is the dose? Like that. Okay. And it is conducted for 2 to 3 years. 2 to 3 years. Success rate is a little bit less. It's 30%. In phase 3, again, we conduct it on the patients only. But phase 2, phase 3, these are randomized control trial. It's not open. Anyone cannot enter. Only patients can enter. In the patients also, we will divide them in 2 groups. Have you read this in PSM? The RCT trials in epidemiology. So we divide the patients into 2 groups. One is experimental group and one is placebo group. The control group is the placebo group. So the patient, the patient is under trial, but patient don't know in which arm of the trial the patient is. The patient will get a drug, but the drug is a real drug or a placebo, patient don't know. That is the meaning of RCT. We are doing so to eliminate the selection bias, right? Anyways, it is also RCT. Here we are confirming the same efficacy and dosing only, but on a larger population. Here we take 500 and here we take many hundreds or thousands of participants are there, and it is conducted for 3 to 5 years. And finally, we conduct phase 4. It is after the launch. Now, after phase 3, if it is everything is good, the government will allow you to launch it in the market. Now in the market, post-marketing, when everyone will purchase and take that drug, so it is again open. It is a volunteer, no, it is open. It is not RCT because it is post-marketing. People will purchase it from the medical store and take it for that disease, right? You are looking for the adverse effect, any compliance, any drug-drug interaction, because when patient will take it, patient will not take one drug, patient will take multiple drug along with this drug. So drug-drug interactions, right? And there is no fixed duration. It is always goes on. So this is phase 4. Now read your question very well. They are asking you, patients are first enrolled in which phase? The first time patient will come in phase 2. And instead of patient, if they ask participants, the volunteers, the healthy individuals, it's phase 1. So that is the question. Got it? Can we go ahead? Okay, the next question. Now we are done with the general. We have seen many important topics in the general, and it's a rapid review now of the overall entire pharmacology. I cannot take all the topics in detail and every topic. So most important topics in the general, I tried to take it. Right, now let's do some systemic pharmacology. Okay, so the next question is from diuretic. Okay, one of the diuretic is furosemide. So the question is on action, the site of action of the furosemide. You know, diuretic. Furosemide is a diuretic. We all know it's a loop diuretic. The first thing in pharma na, okay, apart from question, ek chota sa advice. In pharma, if you are studying pharma, you are any student. You are a first year, second year, third year, final year, intern, you are a FMGE student preparing for any exam. If pharma is your subject na, my nice advice, my very wise advice to you, learn all classification first. All the classifications. There are nearly 40 to 50 important classifications in pharma. And there is a book of classification. There is a separate book of classification in which only classification is there of the drugs. No details, no nothing, just classification. I request you to write down all the classification on one page like this. You should know the classification. Like this, there is a book. So I can also share the PDF. Some 40-50 classifications are important, not all. Okay, like this all. So this is a classification of diuretic. You should know the classification of heart failure drug. You should know the classification of this, that, like that. And you should take a printout of that, write down on one page and stick it on your walls, where you reside in your room. Looking at the drugs again, you will identify this drug is from this category. So because whenever any question comes from the pharmacology, if you don't identify the drug, how you will solve the question? You fail and the question only. You no need to see the option itself. If you don't know furosemide is a diuretic, how you will respond to this question, I mean solve this question? The first thing, you should know all the classification. Learning or rectification is not required. Reading only classification will also work. If you read it, in the option you will identify that furosemide was there in the diuretic. Right. Now, what is a diuretic? What is a diuretic? Diuretic is any drug. Diuretic is any drug that cause excretion of sodium and water in the urine. More sodium, more water in the urine. So urine output will increase. So what is the use of this drug? Why we give it to any patient? We give it for edema. Imagine any edema patient coming to me. Edema को हिंदी में कहते हैं swelling, सूजन, है ना? Patient will simply say, doctor, I'm having a swelling on the face, swelling on the neck, swelling on the hands, swelling on the body, the complete body, anywhere, swelling. हिंदी में कहेगा patient, doctor साहब, मुझे सूजन आ गई है. Very simple, है ना? बहुत common है, it's very common, right? So like fever के लिए हम PCM देते हैं ना, paracetamol. Paracetamol, PCM. Paracetamol is a symptomatic treatment for the fever. A fever can be due to typhoid, can be due to dengue, can be due to malaria, can be due to COVID. So specific treatment is required for the cure. If you want to cure the fever, you have to give anti-malarial, anti-typhoid, whatever the disease is. But temporarily, just for subsiding it, you can give PCM. PCM is not a treatment, it's a symptomatic treatment. In the same way, diuretic is not a specific treatment, it's a symptomatic treatment. It will just reduce the edema, whatever is the cause of edema. It will reduce the edema, but edema mein kya hai? Extra water. The extra water and sodium is excreted in the urine. So edema will be reduced. But if you don't cure the main disease, edema will come again. So again, diuretic is a symptomatic treatment, not a cure of the disease. It is given for the edema. Okay, so this is a basic of the diuretic. Diuretic acts on the kidney, of course, because they increase sodium and water excretion in the urine. So they act on the kidney. In the kidney, we have nephron. So which portion of the nephron they act? Thick ascending limb of loop of Henle, descending limb of loop of Henle, PCT or DCT? What is the correct answer? What is the correct answer? Can you try? Yes. The correct answer is A. Most of you are right. Mahajan, Radheshyam and KPS, you all are right. But let me explain you all the diuretics to you, everything about the diuretics. Let's start diuretic. I have already given the basics what is diuretic, right? Now let me classify the diuretics. So there are three type of diuretics based on their efficacy: high efficacy, medium efficacy, or weak. High efficacy, they will excrete, you know, liters of urine. If you give one tablet, the patient will have 5 liters of urine. So if the patient is having severe edema, pulmonary edema, it's an emergency, give loop diuretic, the high ceiling one. The high ceiling one are known as high ceiling or high efficacy. These are known as loop diuretic. These are known as loop diuretic, and here we have main drug is furosemide. The hero here is the furosemide. Apart from that, we have torresemide, bumetanide, but main is furosemide, which is our question right now. Apart from that, in the medium we have thiazides, benzothiazide, yeah, thiazide like. These are all thiazide. I will call them in short thiazide. Read the drugs inside them. And in the weak, we are having three categories: carbonic anhydrase inhibitor, I will call them C, osmotic diuretic, I will call them O. These are sugars. And potassium sparing, I will call them P. I'm not reading the drugs inside that, if it will take time, but I'm assigning one letter to make a mnemonic. What is the letter I have assigned? These are loop diuretics, these are thiazides, these are carbonic anhydrase inhibitor C, osmotic diuretics O, and potassium sparing diuretics is P. C, T, P, C, O. So in the classification you should know the 5 names, right? Now, do you know nephron? How to draw a nephron? I guess in our childhood only we learned how to draw the nephron in our school age. So nephron mein there is a Bowman's capsule, inside which there is glomerulus. This is proximal convoluted tubule, PCT. This is loop of Henle. Loop of Henle have 2 limbs, descending limb, ascending limb. Then this is distal convoluted tubule, DCT, and this is collecting duct. So none of the diuretic acts on the glomerulus or Bowman's capsule. Okay? So this is PCT. This is loop of Henle ka descending limb, ascending limb. This is DCT, distal convoluted tubule, and this is collecting duct. So my mnemonic is COLT-P, C-O-L-T, COLT-P, P means urine, so COLT-P, you can learn it's a mnemonic. So C for carbonic anhydrase inhibitor, I told you. So carbonic anhydrase inhibitor will act on PCT. O is osmotic diuretics. All the osmotic diuretics acts on descending limb of loop of Henle. L means loop diuretic, that is our question right now. Furosemide is a loop diuretic. So that acts on ascending limb of loop of Henle, that is our answer right now. Thiazide, koi bhi thiazide de du main, benzothiazide, thiazide like, they act on DCT. And finally, the potassium sparing, they act on collecting tubules. Give me a thumbs up, you got it. So this is the mnemonic COLTP. So you can see COLTP, COLTP. Carbonic anhydrase inhibitor, osmotic diuretics, loop diuretics, thiazides, and potassium sparing. So here we will start from PCT, descending limb of loop of Henle, ascending limb of loop of Henle, फिर क्या आता है DCT, और फिर क्या आता है collecting tubule. You don't forget the diagram of nephron. Nephron का sequence तुम्हें पता है ना? So write down COLTP like this, and if you know the full form, you can make it out. If I ask you any drug, if I ask you what is the mechanism of action of acetazolamide, so you know acetazolamide is a carbonic anhydrase inhibitor, and carbonic anhydrase inhibitor acts on PCT, so my answer is PCT. Here I asked you for furosemide. We know furosemide is a loop diuretic. Loop diuretic act on descending limb of, ascending limb of loop of Henle. So correct answer is ascending. If I ask you mannitol, glycerol, so these are osmotic. So my answer will be descending limb of loop of Henle. If I ask you any chlorthalidone, hydrochlorothiazide, benzothiazide, 𝗲𝗵pamide, koi sa bhi thiazide, so all thiazides acts on DCT. And if I ask you any of the potassium sparing, spironolactone, amyloid, so answer is collecting tubule. Kindly respond, people. Got it? Yes or no? So this is a great mnemonic, and you get many questions on that. Have a look on your question and tell me the answer. They're asking for furosemide. Now furosemide is what? Furosemide is a loop diuretic. It's a loop diuretic. So COLTP, loop diuretic. Where does it act? It acts on ascending limb of loop of Henle, not descending. If instead of furosemide, if I ask you mannitol, it's an osmotic diuretic, answer will become B. So this is how we can answer this question. Got it? Write down. Okay, yes, COLT-P is the mnemonic. You get many questions on that, right? So let's play a game. Fastest finger first. ABC. Fastest finger first. So let's play a game. Let me see who is first to answer this question. Okay? So what is the question? Let me explain your question. Then I will give you a few seconds, 30 seconds to solve that. In KBC also you get 30 seconds. How many seconds you got that? So arrange the following diuretic according to their mechanism of action, site of action, from proximal to distal part of the nephron. So you know proximal to distal part of the nephron, first there is a glomerulus, then PCT, then loop of Henle, then DCT. So there the 4 options are triamterene, hydrochlorothiazide, acetazolamide and bumetanide. If you know the classification in which category they belong, you can arrange them on the nephron where they act. So what is the correct sequence? Is it ABCD, CDBA, DBCA or BCAD? Your time starts now. So someone already answered. Great. Kishore? I don't know the answer. Let me see. Kishore is saying B. What about others? Fastest finger was first, winner will be one only, huh? Not all. So what is the correct answer, correct sequence? So the clinch in the question is that you should know two things. Number one, you should know the classification very well, and number two, you should know the mnemonic of the mechanism of action, cold P. Cold P to sabko pata hai, classification kitno ko pata hai? Okay. Triamterone, where does triamterone come? It come in potassium sparing drugs. Okay. Hydrochlorothiazide comes in thiazide category. Acetazolamide comes in carbonic anhydrous inhibitor, and bumetanide is like furosemide. It is one of the loop diuretic. Now you can do it. I have written one letter in front of them from their category. So what is the mnemonic? I told you the mnemonic is COLTP. So C is given, है ना? Acetazolamide सबसे पहले आएगा C. Okay. Then O, osmotic diuretic is not at all. None of the option is osmotic. L is loop diuretic. L is option D. Okay. Then T is thiazide. Thiazide, one of the thiazide is hydrochlorothiazide. It is option B. And T is potassium sparing. Potassium sparing is triamterone. So answer is A. According to me, answer is B. This is how I will approach to this question, है ना? So the correct answer is B, and CDBA is the correct sequence. So let me see who has answered it correctly. So CDBA is answer number B. Everyone is correct, but the first one was Kishore. So yes, so you all are correct. So this is how we should approach this question. Can we go ahead? It is a very difficult level question asked in your exam. One of the year past paper have this question, right? So let's come on the next question, the next concept, the antibiotics. Let's start antibiotics. Are you people with me? Can we go ahead? Huh? The antibiotics. Can we continue with antibiotics? The next question is in front of you. Tetracycline inhibit protein synthesis by what? What is the mechanism of action of tetracycline? Tetracycline inhibit protein synthesis by what mechanism? The question is in front of you. Is it inhibit initiation and cause misreading? Is it bind to 30th subunit and inhibit the binding of amino acyl tRNA? Is it inhibit peptidyl transferase activity, or is it inhibit translocation? What is the correct answer? Give a guess at least. The correct answer is B. I will come on the question again. Don't worry. You get many questions on this. So let's talk about the drugs which are protein synthesis inhibitors. I want to talk about four antibiotics here. What are the four antibiotics I want to talk about? Tetracycline, aminoglycoside, chloramphenicol, and macrolides, that is erythromycin. These four antibiotics I want to talk. They all inhibit protein synthesis. What do you mean by protein synthesis inhibition? Okay, this is a bacteria. This cell is bacterial cell. Please see, this is a bacterial cell. This is the nucleus of the bacteria. This is the DNA inside the bacteria. This is the ribosome of the bacteria, and here protein synthesis takes place. Okay, and this is the cell wall of the bacteria. All bacteria have cell wall, whether gram positive, whether gram negative. Listen, this bacteria present in my patient's body. What, being a doctor, what is my responsibility? To kill this bacteria. I want to cure my patient. So this is a bacteria present in my patient's body causing some or other disease. And being a doctor, I want to kill this bacteria so that my patient become cured. There are four ways I can do so. Number one, I can give some drug to the patient that inhibit the cell wall synthesis. In this bacteria, once the cell wall synthesis is inhibited, it will rupture, it will burst, bacteria will die. These are bactericidal drugs, hai na? So penicillins, beta-lactams will come there, right? So this is the first method. The second method, I can give a drug which acts on the cell membrane and cause pores in the cell membrane, so that all the cytoplasm will leak out and the bacteria will die. So these are certain drugs that will act by this mechanism. The third category, there are certain drugs that act on the nucleic acid synthesis. Nucleic acid synthesis. So DNA synthesis inhibitor, RNA synthesis inhibitor, direct inhibitor, indirect inhibitor, है ना? Direct inhibitor में they inhibit DNA or RNA synthesis. These are the drugs. So no DNA RNA synthesis, the cell will die, or it is bacteriostatic. Or indirect inhibitor में for DNA and RNA synthesis, folic acid is required. So drug will not inhibit DNA or RNA synthesis. Drug will inhibit folic acid synthesis. No folic acid, no DNA, no RNA. So these are indirect inhibitors. So these are known as nucleic acid synthesis inhibitors. Nucleic acid synthesis inhibitors. And lastly, the most important, protein synthesis inhibitors. So there are certain drugs, protein synthesis inhibitors, that act on the ribosome. In the ribosome also we have two portions. What are the two portions of the ribosome? 30S and 50S. These are the two portions of the ribosome. So the drugs acts either on 30S or 50S or the junction of the two, and they inhibit the protein synthesis in the bacteria. So no protein is formed in the bacteria. So bacteria will not die, but bacteria cannot reproduce. So these are not bactericidal but bacteriostatic. So here currently for this question I am concerned with this category. I am. In the next question, I will teach you this nucleic acid synthesis also. There are many questions. So here in this question, I am concerned with this category. So here 4 drugs come. Which 4 drugs? Tetracycline, chloramphenicol, aminoglycoside and erythromycin. These are the 4 main drugs. They all cause protein synthesis inhibition, but the mechanism here is different. They all act on ribosome. Some on 30S, some on 50S, some on both the junction, but the exact step is different. So for understanding the mechanism of action of these 4 drugs, you frequently get question on these 4. Usually बहुत common है इस पे question आना. Okay, it's very common. So these 4 drugs, they all inhibit protein synthesis, but the step is different. For that, you have to understand the steps in protein synthesis. What are the steps? So which step is inhibited by which of the 4 drug? There are 4 steps. 1-1-1-1 step is inhibited by 1-1-1-1 drug. Okay. So this you have read in biochemistry, in your childhood in 9th-10th standard, in your biology also you have read how does protein synthesis takes place. So tell me, how does protein synthesis takes place? Okay, see, this is a cell, bacterial cell, not human cell. Okay, see the sketch diagram, see the beauty I have drawn. I have done my homework. I am not drawing it. I have already drawn. Just have a look how beautifully I have explained. Listen and appreciate my efforts. Listen, everyone on the screen, everyone on your gadgets. Listen, this is a bacterial cell, inside which have a look on the nucleus. This is the nucleus. Inside the nucleus, see the double-stranded DNA. Okay? This is the double-stranded DNA. Now, in the double-stranded DNA, how does protein synthesis takes place? The 2 strands get separated. One is leading, one is lagging. You can see. Okay, just a second. One of them may be leading strand, one of them may be lagging strand. You may know that. Leading strand pe mRNA synthesis takes place. The complementary strand is mRNA. This is known as transcription. This is known as transcription. In transcription, DNA get converted to RNA. The DNA get converted to RNA in the nucleus on the leading strand. The complementary copy of the DNA is formed, that is known as messenger RNA, mRNA. This is known as transcription. None of these 4 drugs, mind my words, tetracycline, chloramphenicol, aminoglycoside and erythromycin. None of these 4 drugs act on this step. No, this step is normally going on. Now, in the next step, so this is transcription. In the transcription, what is happening? The DNA get converted to mRNA. Now this mRNA comes out. This mRNA which is synthesized here, it is coming out in the cytoplasm, going to the ribosome, where mRNA will convert into protein, and this is known as translation. So all the 4 drugs will act on translation. They inhibit one of the step of the translation, that is a concept, है ना? पहली चीज ट्रांसक्रिप्शन को कोई भी इनिबिट नहीं करता इन चारों में से. ये चारों के चारों इनिबिट तो ट्रांसलेशन को करेंगे, लेकिन डिफरेंट स्टेप. ट्रांसलेशन में 4 स्टेप होती हैं. ईच ड्रग विल इनिबिट 1 स्टेप, है ना? व्हाट इज ट्रांसलेशन? कन्वर्शन ऑफ mRNA to protein taking place in the cytoplasm, in the ribosome is translation. So I told you there are 2 steps in protein synthesis: transcription and translation. Say yes. Say yes. So in transcription, DNA get converted to mRNA, and in translation, so this takes place in the nucleus, है ना? And in translation, mRNA get converted to protein. There are codons. It is converted to protein that takes place in the ribosome, है ना? You have to understand the detail. ठीक है? So let's see. This is going. This mRNA is coming out and going to the ribosome. Let's see the ribosome in detail. Let me zoom out the ribosome. In the ribosome, there are 2 windows. This is P window, this is A window. You can see this is P window, this is A window. Let's see the 2 windows together. In the ribosome, there are 2 windows. You can see P and A. And in the ribosome, there are 2 portions, 30S and 50S, according to the sedimentation unit. 30 and 50S. And the 2 windows. Now, when mRNA is coming, on the mRNA, codons are there. The triplet of the nucleotide is known as codon. Codon 1, codon 2, codon 3. One codon codes for 1 amino acid. This is the basic you may know. So the first codon bind on P window and the second codon bind on A window, and this all. So each codon codes for 1 amino acid. I will not read this table, but you know which codon codes for which amino acid. Now this all is taking place inside the cell of the bacteria. See, this is the bacterial cell. Have a look on the ribosome. Have a look on the ribosome. In the ribosome, see, on the P window, first codon is there. On the A window, second codon is there. Now in the cytoplasm, 20 types of amino acids are present. There are 20 types of amino acid, number 1, 2, 3, 4, 5. Each amino acid have a unique codon. Each amino acid, and they all are present on tRNA. They have their cycle, they have their scooters, they are not going walking, they have their transporter. The transporter is the tRNA. This is the tRNA on which amino acid 1, 2, 3, they are sitting on their tRNA. So whenever the ribosome will call, listen here, the ribosome will call here, who is the first codon? Just suppose the first codon is anything AUC, Who is AUC? Who's standing for AUC? Please come here. So that particular amino acid will come. That particular amino acid will come and bind here. This is the first amino acid you can see. The first amino acid which is standing for this particular codon, it will come and bind here. This step is known as initiation. I will tell you 4 steps. Pehli step is initiation. है ना, और which drug inhibit which step ये भी बताऊंगी मैं. Okay, got it? So here first step is initiation, in which the first amino acyl tRNA, जो tRNA with amino acid, it is coming and binding on the P window. Initiation always take place on P window. Please learn, है ना. The second step, attachment of the new amino acid on A window. So whatever amino acid standing for C2, that will come and bind on the A window. So the first for C1 will bind on the P window, and for second C2 is binding on the A window. This is step number 2. The new amino acid is coming and binding on the A window. The first step is on P window, that is initiation. ये initiation P window पे होती है, ये वाली step A window पे होती है ना, है ना. So this is pre-existing amino acid, this is new. Pre-existing present on P window and new is present on A window, right? The third step, peptide bond formation between the two. दोनों आपस में bond बना लेंगे, the pre-existing with the new, and pre-existing will move towards the new, not new towards the pre-existing. It is a rule. Pre-existing new की तरफ जाएगा, उसके ऊपर जाके बैठ जाएगा. It will form a peptide bond, है ना. So you can see the P window will become empty. You got my point? It is known as P to A shift. P to A, you can see, है ना. So A2 उसके ऊपर आ गया A1, है ना. P window is empty now. This is step number 3. Step number 3 is P2A. I will call this step as P2A, peptide bond formation between the two amino acid and shift of the amino acid from P to A. This is step number 3, right? Step number 3. Now step number 4 में पूरा, please understand, it's the last and the difficult step. पूरा का पूरा ribosome, it's a 3-dimensional step. एक कोडॉन आगे मूव कर जाएगा. It will move by 1 codon ahead, है ना. एक कोडॉन आगे. So ये जो P window है, it will come on the A. It will come on the A. और जो A window है, it will go on the new codon. It will go on C3 and C1 will become empty, है ना. You can see C1 empty हो गया, P जो है वो A पे आ गया और A और आगे चला गया. So this amino acid जो A1 और A2 हैं, they will shift from A to P. ये यहीं पे रहेंगे. Amino acid will remain there only ribosome is moving. So they will shift from A to P. So this step, the last step, is known as translocation and it is known as A to P. So what are the 4 steps, please? The first step is initiation. The first step is initiation. It takes place on P window. The first amino acid is coming and binding. The second step is new mRNA, new amino acid is binding on the A window. The third step is peptide bond formation between the new and the pre-existing one and shifting from P to A. Okay, and in the last step there is translocation of 1 codon. Pura ka pura codon jumping is there, and here the amino acid shifts from A to P. Now there are 4 drugs now. Aminoglycoside inhibit P window, inhibit initiation. That is our question. Aminoglycoside do so, है ना. Aminoglycoside inhibit P window, inhibit the initiation. They cause misreading also, right? Tetracycline inhibit the second. It inhibit the coming of new amino acid on the A window. They inhibit A window, right? They inhibit A window. And what is the third drug? Chloramphenicol. They inhibit P to A shift, है ना. They inhibit the peptide bond formation between new and pre-existing one. And last one, erythromycin or macrolides. They inhibit the last complete ribosome shift by 1 codon. That is translocation. So A to P. So this is the summary. Got it? How many of you got it? How many of you got it? Huh? So this is the 4 amino acids, 4 protein synthesis inhibitors, antibiotics, the mechanism of action I told you. So see, aminoglycoside. A for aminoglycoside, it is inhibiting the initiation. The first step, they are inhibiting the P window. Kindly respond, say something. So they are inhibiting the P window. The aminoglycosides, they inhibit the step number 1, initiation. The second is the tetracycline. They inhibit A window. So they inhibit step number 2, that is binding of new amino acid on A window, right? The third is chloramphenicol. Chloramphenicol inhibit the bond formation, peptide bond formation between pre-existing and new, and the shift from P to A. It is blocking shift from P to A, right? And the last one, erythromycin, it is inhibiting A to P shift. That is the complete translocation by 1 codon. Kindly give me a thumbs up, say something. Got it? Huh? So it was a difficult portion, but I tried my best, right? So please learn the 4 drugs are in front of you: tetracycline, chloramphenicol, aminoglycoside, erythromycin. Their mechanism of action, at least I told you. Now I'm showing you a master table. I want you to compare these 4 drugs in one shot, right? You should know the classification of all these 4 drugs, the spectrum of all these 4 drugs, the adverse effects and uses. For adverse effects, I am having 4 mnemonic, and for uses also I am having 4 mnemonic. So total 8 mnemonics are there, and mechanism of action I already taught you. So in your exam, you always get a question on these 4 drugs, one of the 4 drugs, not all 4, either on their mechanism of action or on their adverse effect or on their uses. But which question you are going to get this year, I don't know. But definitely you will get one of the question on protein synthesis inhibitors. Say yes. So you want me to take it quickly, tell you the 8 mnemonics, the adverse effect and uses of each of them. Mechanism of action to ho hi gaya na. We have done the mechanism of action. So adverse effect and uses, you want me to tell it quickly? I will be very quick. So let's start with tetracycline. Start filling this table with me. I will fill it with you. Let's start with tetracycline. Tetracycline are known as tetracycline because it is having 4 rings. 1, 2, 3, 4. Don't learn the diagram. It is having 4 rings, 4 benzene rings. So that is the meaning of the tetracycline. In the classification, there are 3 types of tetracycline. Group 1, group 2, group 3. In group 1, that is tetracycline, chlorotetracycline, oxytetracycline. In group 2, it is demaclocycline, lemmicycline. And in group 3, it's doxycycline and minocycline. If you want to learn, it's good. If you don't want to learn, it's okay. But this is the classification of tetracycline. In the spectrum, it's a broad spectrum. They kill everything. All the gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. They kill the spirochetes also, rickettsias also, mycoplasma also, and protozoa also. They kill everyone, the broadest spectrum. Okay? Mechanism of action we have already discussed. Step number 2. They inhibit step number 2. Step number 2 means they act on A window. They inhibit A window. They inhibit A window and they act on 30S of the ribosome, not 50S. And these are bacteriostatic. The bacteria will not get killed but cannot multiply. So this is mechanism of action. Adverse effect का mnemonic है 𝗏𝗃𝗏𝗏𝗃 PT teacher. L liver damage. Tetracycline cause liver damage. That's why patient can have jaundice if prolonged use of tetracycline. K is kidney damage. Kidney damage can be caused. A is anti-metabolic effect. The patient can have anti-anabolic effect. I'm sorry. Okay. D is diabetic insipidus. Only by demaclocycline, not by all. V is vestibular toxicity. Patient can have vertigo, vestibular toxicity in the ear. And now P is phototoxicity. T or T, there are 2 T. One is teeth and bone may it form chilids, and one T is teratogenic. Never give tetracycline to any pregnant lady, it is teratogenic. So 𝗏𝗃𝗏𝗏𝗏 is the PT teacher. इसका जो I है वो भी intracranial pressure raised है. So 𝗏𝗃𝗏𝗏𝗏 AD will clue. Advani is PT teacher. Say the full form. Tetracycline side effect. Liver damage, kidney damage, anti-anabolic effect. Okay. Diabetes insipidus, not diabetes mellitus. Vestibular toxicity causing vertigo. Increase intracranial pressure, hydrocephalus. Phototoxicity in the eyes. Teeth deposition, bone deposition, and teratogenic. So this is a mnemonic. You get many questions on that, right? These are the adverse effects. If you don't want to learn, there is another one, 𝗏𝗃𝗏𝗏𝗏𝗏. But if you see the full form is same. Don't learn both. Either learn this or learn this. Okay. Uses क्या हैं? The uses, tetracycline is drug of choice. Drug of choice for these diseases. So mnemonic is vacuum BR, bedroom, vacuum bedroom 2, or vacuum the bedroom, whatever. V for Vibrio, Vibrio cholerae. A for acne, है ना? Acne में drug of choice is tetracycline. C is chlamydia. U is ureoplasma. M is mycoplasma. Ureoplasma, mycoplasma, bhai. Vacuum. BR, bedroom. BR. Borrelia, rickettsia. And the या 2, whatever. Toluramia. So vacuum. है ना? Double C नहीं एक ही C है. Vacuum the bedroom. I write like this. Vacuum the bedroom. Say the full form. Vibrio, acne, chlamydia, ureoplasma, mycoplasma. Toluramia, Borrelia, rickettsia. The drug of choice, tetracycline in all these. Got it? Say yes. So we are done with tetracycline. Okay. Coming on the next, chloramphenicol. Chloramphenicol, you can see the spectrum is same. Mechanism of action, it is inhibiting step number 3. It is inhibiting the step number 3, inhibiting peptide bond formation between the pre-existing and the new one. Okay. And it is acting on 50S of the ribosome. Please mind, here it was acting on 30S, here it is acting on 50S. Here it is inhibiting the step number 2. Here it is inhibiting the step number 3. Both of them are bacteriostatic. The adverse effects are big super hypersensitivity. B stands for bone marrow depression. I stands for irritative effects like nausea, vomiting. G for gray baby syndrome. Very commonly asked question. Super is super infection. Hyper is hypersensitivity. Very easy. So big super hypersensitivity. And what is the uses? Uses is Bayer TB. Don't give chloramphenicol because of the bone marrow toxicity. हम देते ही नहीं हैं. लेकिन कभी देना भी है तो only Bayer TB. B for bacterial meningitis. A for anaerobic infection. R for rickettsia. E for ear and eye infection. Typhoid infection and brucellosis. So please learn. 𝗏𝗃𝗏𝗏𝗏 Advani PT teacher. Vacuum bedroom 2. Big super hypersensitivity and Bayer TB. So I have given you 4 mnemonics. Please see the mechanism of action, which step they are inhibiting. Please see which portion of ribosome they are acting, 30S or 50S, and see their spectrum. Both of them are broad spectrum. Got it? Give me a thumbs up. Can we go ahead? Kindly write down something. Okay. Coming on the third aminoglycoside. Okay. Aminoglycoside. Structure you don't have to learn. Classification, do it by yourself. There are two types of aminoglycosides, systemic and topical. There is no oral tablet. Oral aata hi nahi hai. Either they are injectables, most of them are injectables, and only two are topical in the form of the ointment. The topical one are neomycin and 𝗲𝗏. So according to me, learn the topical. Remaining all are systemic, you can learn like that. Systemic sub hai. Lekin topical are only two, neomycin and 𝗲𝗏. NF, neo and 𝗲𝗏 are topical, they are in the form of the ointments, है ना? Neomycin eye drops आते हैं, neomycin के, and 𝗲𝗏 का ointment आता है. So neomycin and 𝗲𝗏 are there, remaining all are systemic injectable. None of the anti-aminoglycoside is oral. Okay, that is the classification we have seen. Spectrum is very unique. They act only gram-negative bacilli. There are four types of bacteria: gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. So they act only on gram-negative bacilli. Very specific, unique spectrum, narrow spectrum, not broad like everything. No, it's not like that. Only gram-negative bacilli. है ना? Mechanism of action inhibit step number 1. Inhibit the initiation. Initiation को inhibit करेगा. Step number 1, right? And it acts on both 30S plus 50S. Now please do a comparison. Tetracycline was inhibiting only 30S. Chloramphenicol inhibiting only 50S. Aminoglycoside inhibit both 30S, 50S plus the junction. This one was inhibiting step number 2. This one was inhibiting step number 3. This one is inhibiting step number 1. That is on initiation, the first step, the P window. है ना? This one is bacteriostatic. This one is bacteriostatic. This is both static and 𝗲𝗏. It inhibits the bacterial cell division. It kills the bacteria also. See the comparative analysis, how beautifully I am saying. Adverse effect is double on HT, on hypertension or on HT, है ना? ONN, autotoxicity, nephrotoxicity, neuromuscular toxicity, 3 toxicity है. Autotoxicity, person will become deaf, permanent deaf, and a very dangerous drug. If you increase the dose, person become permanently sensory neural deafness is there. Person will kill you, bilateral deafness. Okay, so these are very dangerous drugs. Please give in the proper dosage only. If you increase the dosage by any cause and it causes the autotoxicity, it will be permanent. Nephrotoxicity is there, which is reversible. Once you stop the drug, it will reverse, है ना? And neuromuscular blockage, the person can have paralysis. ठीक है, hypersensitivity तो सब में होता ही है, allergy, and T for teratogenic. These are also teratogenic like tetracycline. So that is on HT. You can see on HT. Coming on the uses. For uses, I don't have any mnemonic, right? They are used for gram-negative infection because they are active only for gram-negative bacilli. So all gram-negative infections, right? All gram-negative infections. No mnemonic is there. Last one is erythromycin. That is one of the macrolide because it is having a big ring. That's why macrolide. So macrolides are there. There are many macrolides. The prototype drug here is erythromycin. ठीक है, spectrum देखो. Here the tetracycline and chloramphenicol were acting on all 4: gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. The aminoglycoside was acting only on gram negative bacilli. तो बाकी तीनों को लग गया बुरा. Gram positive cocci, gram negative cocci, and gram positive bacilli, they are feeling bad. कि why aminoglycoside is not active against us? So इन तीनों के लिए फिर erythromycin आया. Erythromycin is active only against these 3, not against gram-negative bacilli. So this and this is narrow spectrum, but these 2 are broad spectrum. Please understand. Got it? So spectrum is very important. Being a doctor, you will see what is the infection. Based on that infection, you will see which drug is effective. If some gram-negative bacilli is causing the infection, you cannot give erythromycin. It is not active for gram-negative bacilli. And if some cocci infection is there, you cannot give aminoglycoside because it is not effective against cocci. So spectrum and broad spectrum you can give in all infections. ठीक है. Mechanism of action is inhibiting the last step. Step number 4, translocation, and it acts on 50S. Now please do a comparative analysis. And it inhibits the last step. It is also bacteriostatic, है ना? The adverse effect is macro. M for motilin receptor agonist. In the intestine of human, motilin receptors are present, and they are agonists for that, so they causes diarrhea. They causes peristalsis and causes diarrhea. A for allergy. Allergy तो सब में होता ही है ना? C for cholestasis. Cholestasis मतलब jaundice. And RO, reversible autotoxicity. Autotoxicity was caused by aminoglycoside also, but that was irreversible. This one is reversible. And the uses is only for disease claw, CLAW, है ना? Chancroid, L is Legionella, A is atypical pneumonia, W is whooping cough. There are 2 C, Chancroid and Corynebacterium. So that is claw. So the mnemonics are in front of you. I tried my best that in the shortest time I had given you all overview of the all protein synthesis inhibitors. We will revise quickly in just 1 minute. Everyone on the screen. Tetracycline, chloramphenicol, aminoglycoside, erythromycin. They all inhibit protein synthesis. Protein synthesis in the bacteria, right? Regarding their spectrum, you get many questions. Tetracycline is broad spectrum. Chloramphenicol is broad spectrum. Aminoglycoside acts only on gram-negative bacilli. Erythromycin do not act on gram-negative bacilli except that it acts on all cocci, gram-positive, gram-negative and gram-positive bacilli. The remaining 3 will come here, right? Regarding their mechanism of action, so all of them are bacteriostatic except aminoglycoside, which is static and 𝗔𝗃, both very important PYQ, believe me. Hai one more thing you have to learn, on which S of the ribosome they are acting. This is 30S, this is 50S, this is also 50S, but again aminoglycoside on 30S also, 50S also, and junction also. Again a very important PYQ. And which step they are inhibiting, you know the name of that step, I guess, right? Please learn the adverse effect of all of them and uses of all of them. Adverse effect, 𝗏𝗃 Advani, PT teacher, vacuum the bedroom. This is for tetracycline. Learn the mnemonic at least. In the exam you can apply. Option में समझ में आ जाएगा किसका मतलब क्या है. Chloramphenicol, big super hypersensitivity and Bayer TB. Aminoglycoside में on HT और gram negative bacilli की infection. और erythromycin में macro and clo. I tried, at least I tried. है ना? People will not try, at least I tried. Got it? So let's come on the next question. The next question is in front of you. No explanation is needed. You can do it by yourself. Tell me the correct answer. Which of the following is a side effect of streptomycin? Can you tell me which of the following is a side effect of streptomycin? Is it phototoxicity, hepatotoxicity, autotoxicity, or all of the above? Streptomycin क्या है? Streptomycin is one of the aminoglycoside. So what is the mnemonic of aminoglycoside? I told you right now. It's on HT. So in on HT, autotoxicity is coming, but phototoxicity and hepatotoxicity is not coming, right? So correct answer is not D. The correct answer is C. है ना? It is not necessary कि option में all of the above हो तो वही answer होता है. Please ये mentality को ठीक करो, है ना? Streptomycin की जगह if I change the question to tetracycline, what is the answer now? Tetracycline का क्या mnemonic है? 𝗏𝗃 Advani, PT teacher, है ना? So phototoxicity and liver toxicity. Liver is hepato. Both are coming. So A and B will become your answer in that case. So this is how the mnemonics will be useful for you. Okay? The mnemonics will be useful for you. Can I go to the next question? Antibiotics, definitely you get many questions in pharmacology. Antibiotics, antimicrobials is a very important unit. You cannot miss that. And this is the simplest way you can learn. And believe me, no one will teach you with such a simplicity, in such a super simplified manner. Got it? Coming on the next question. The next question is in front of you. Which of the following is a side effect of sulfonamide? What is the correct answer? Read the question. Tell me the answer. Constipation, joint pain, crystalluria and hyperkalemia. What is the correct answer? Can you please tell me the correct answer? Yes, please. The correct answer here is crystalluria. Let me explain you everything about sulfonamide and I will come on the question again. What is sulfonamide? I told you this is a bacteria. What are the ways to kill it? This is the cell wall of the bacteria. This is the nucleus of the bacteria having DNA in that. And this is the ribosome. I told you, I guess, the 4 ways. Number 1, inhibition of cell wall synthesis. Number 2, causing holes in the cell membrane, pores in the cell membrane. Number 3, protein synthesis inhibitor. We have seen the protein synthesis inhibitor, the 4 drugs I explained in detail. Lastly, nucleic acid inhibitors. So let's talk about nucleic acid inhibitor. Nucleic acid inhibitor. Sulfonamide is one of the nucleic acid inhibitor. Now here nucleic acid inhibitor are of 2 types, direct inhibitor and indirect inhibitor. So sulfonamide is one of the indirect inhibitor. Sulfonamide and trimethoprim, both of them. The combination is known as cotrimoxazole. So these are indirect inhibitor. By indirect inhibitor का क्या मतलब है? They do not inhibit DNA synthesis. They do not inhibit RNA synthesis. They inhibit folic acid synthesis inhibition. Folic acid को नहीं बनने देंगे. And folic acid is a must for DNA and RNA. So no folic acid, no DNA, no RNA synthesis. Got it? So this is a way. Got it? So they inhibit folic acid synthesis. Okay, so this is the mechanism of action. How does folic acid synthesized? Folic acid, tetrahydrofolic acid is synthesized from PABA. PABA, है ना? PABA get converted to dihydrofolic acid and dihydrofolic acid get converted to tetrahydrofolic acid. है ना? 2 steps are there. So for the first step, enzyme is folate synthetase. Folate synthetase convert PABA to DHFA, dihydrofolic acid, and dihydrofolate reductase, the second enzyme that is known as dihydrofolate reductase, DHFR. It converts dihydrofolate reductase to tetrahydrofolate reductase. So 2 drugs back to back. Sulfonamide inhibit the first enzyme, so first step do not occur, and trimethoprim inhibit the second enzyme, so second step do not occur. So ultimately folic acid is not formed. Folic acid is not formed, DNA is not formed. DNA is not formed, nucleic acid synthesis is inhibited, bacteria will die. So both of these drugs are indirect nucleic acid synthesis inhibitor. क्योंकि डायरेक्टली डीएनए को कुछ नहीं कर रहे हैं, डीएनए का जो मेटाबोलाइट है फॉलिक एसिड उसको नहीं बनने दे रहे हैं. दैट्स व्हाई दीज आर इनडायरेक्ट इनहिबिटर्स, नॉट डायरेक्ट इनहिबिटर्स. यू गॉट माय पॉइंट? सल्फोनामाइड एंड ट्राइमेथोप्रिम, we don't give them alone, we give them in combination only. So the combination of sulfonamide and trimethoprim is known as 𝗏𝗃 𝗏𝗏𝗏𝗃𝗧azole. Got it? That is 𝗏𝗏𝗏𝗃𝗧azole. So the combination is known as 𝗏𝗏𝗏𝗃𝗧azole. We give them in 5:1 proportion. The tablet 𝗏𝗏𝗏𝗃𝗧azole, right? So we are talking about sulfonamide here. The mechanism of action I already taught you. Now what is the adverse effect? Sulfonamide के adverse effect क्या होते हैं? The adverse effect is ABC of rash. I'm saying you know in entire pharmacology you have 50-60 mnemonics. Learn those 50-60 mnemonics. If you know the mnemonics, अगर सिर्फ mnemonic learn करोगे तो कुछ नहीं समझेगा. With the mnemonic you should have an understanding कि भाई पढ़ क्या रहे हैं, है ना? So chapter by chapter just understand the chapter, understand the drug and see the mnemonic. And in this way you can complete the pharmacology very quickly. Got my point? So ABC of rash is the mnemonic. ठीक है? A stands for aplastic anemia. B stands for bilirubin displacement. Bilirubin को displace कर देगा from the albumin. So bilirubin bind with the albumin. Now this is a bilirubin. In the blood, bilirubin bind with the albumin. Right? Now when this drug is coming, sulfonamide. So albumin have more affinity for sulfonamide as compared to bilirubin. So bilirubin will become free. ये bilirubin को धक्का मार देगा. Bilirubin will become free, and this albumin will bind with the drug sulfonamide. So the free bilirubin will go in the brain and cause the kernicterus. है ना? Damage the basal ganglion and cause the kernicterus. So B for bilirubin displacement, that will cause kernicterus, especially in the newborns. ठीक है? The next is the crystalluria. That is our question right now. C for crystalluria. R for rash. Rash मतलब hypersensitivity तो सब में होता ही होता है. A for acetylation. Acetylation is not a side effect. It is a drug which is metabolized by acetylation. The students who are covering my session from the beginning, I told you acetylation in one of the mnemonic, है ना? So the drugs which show acetylation is 𝗃𝗃𝗃 ABC, है ना? So 𝗃𝗃𝗃 ABC में जो S है वो सल्फोनामाइड ही है ना, कोरिलेट है ना? सल्फोनामाइड में भी मैं बता रही हूँ acetylation, ठीक है? S for SLE कराता है ये SLE like symptoms, और H is hemolysis and G6PD deficiency. Have a look on your question. So which of the following is a side effect of sulfonamide? If you know the mnemonic, you can just apply and tell me the answer. What is the correct answer? ABC of rash, RASH. So in this mnemonic, what it is coming? C for crystalluria. Only C is coming. The remaining things are not coming. Neither constipation, joint pain or hyperkalemia is there. Right? So you should know the full form. If you know the full form, you can easily solve it. Can we go ahead? So that is a side effect of the sulfonamide. Coming on the next question. The next question is, which of the following fluoroquinolone has broadest spectrum activity against the bacteria, है ना? So I am asking about which of the fluoroquinolone have the broadest spectrum of the bacteria. There are 4 types of bacteria: gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. So tell me one of the fluoroquinolone which kills all the bacteria. That is the broadest one. So fluoroquinolone. The question is on fluoroquinolone. So they are asking the classification, but I will explain everything about the fluoroquinolone. So I told you the 4 ways to kill a bacteria. One of the way is nucleic acid synthesis we were talking. This is the bacteria, this is the cell wall. So we have the drugs which inhibit cell wall synthesis. We have drugs which causes pores in the cell membrane. We have the drugs which inhibit ribosome, which inhibit the protein synthesis. Protein synthesis inhibitors, we have seen that. The last one, the drugs which inhibit nucleic acid synthesis. In the nucleic acid synthesis, I told you there are 2 types, direct, indirect. Indirect we have already seen. The indirect are 2. Sulfonamide and trimethoprim. They inhibit 1,1 enzyme in the folic acid synthesis, and they do not form folic acid. So no folic acid, no DNA. Now let's talk about the direct nucleic acid inhibitors. The drugs which directly inhibit the nucleic acid synthesis. So fluoroquinolones is one of the direct nucleic acid synthesis inhibitor. For starting any drug, you should have an overview कि भाई वो drug है क्या? Is it an antibiotic, antifungal, parasitic or what it is, है ना? So पहले तो वो drug है क्या? वो चीज़ antiviral क्या है? So if it is an antibacterial, what is the mechanism of action? Bacteria में 4 ही mechanism है. या तो cell wall synthesis को inhibit करो, या तो cell membrane में pore बनाओ, या तो ribosome को inhibit करके protein synthesis inhibit करो, या तो nucleic acid synthesis inhibit करो. Nucleic acid synthesis inhibition में there are 2 ways, direct and indirect. Indirect we have already seen folic acid को inhibit करती है कौन सी drug? Now direct inhibitor में the main drug here is fluoroquinolone. ठीक है? So let's start the fluoroquinolones. There are many type of fluoroquinolones. I will tell you the classification. Fluoroquinolones, what does they do? See, how does the bacteria replicate? How does the DNA replication takes place? What are the steps? In the nucleus, the double-stranded DNA is there. See, the double-stranded. So first step is unwinding. I say the word unwinding of the double-stranded DNA into two different strands. One is leading, one is lagging. Without this step, you cannot conduct DNA replication. Now on the leading also, one complementary strand will be formed. On lagging also, one complementary strand will be formed, and that enzyme required is DNA polymerase and all. I don't forget, I don't remember all the details, but yeah, some enzyme is required, DNA polymerase, and that complementary strands are formed. So in this way, the bacteria divide, the DNA replication takes place. Agree. But the first step is unwinding. Who does the unwinding? For unwinding, an enzyme is required. Name that enzyme. The name of that enzyme is DNA gyrase. है ना? DNA gyrase ही ये unwinding कराता है. Can you see? Everyone have a look here. Everyone, this is the double-stranded DNA. This is the double-stranded. So double-stranded is getting converted into two different strands, leading and lagging. Who is causing this? The enzyme. The name of the enzyme is DNA gyrase. Fluoroquinolones inhibit this enzyme. हो गई बात खत्म, है ना? The chapter is over. Fluoroquinolones inhibit DNA gyrase. No DNA gyrase. No unwinding, DNA will not do the unwinding, no leading, no lagging, no DNA replication, and the bacteria will die. Bacteria cannot replicate, I mean. So it will interfere with the unwinding. There is no unwinding, no replication. So this is the main mechanism. Got it? So you get many questions on that. Now, how many types of fluoroquinolones are there? This is the mechanism. So for every drug in pharma, there are many drugs. For every drug, you should know the main thing is mechanism of action. In the form of the diagram, flow chart, you should have an overview. You should know the classification of that drug, that complete chapter. By कितने type के tetracycline है, कितने type के amino glycoside है. You should know its mechanism of action, exact mechanism of action. You should know its uses, उसके लिए mnemonic. You should know its adverse effect, उसके लिए mnemonic, है ना. उसके अलावा pharmacokinetics में something extra, some important points, extra points of that drug. So I want you, in pharmacology, you have more than 70, 80, 100 important drugs. So for all the drugs, you should have a comparative table, like the classification, mechanism of action, uses, adverse effect, important point. That's it. The complete pharmacology can be compiled in 30-40 pages. Just 30-40 pages of your copy. And any question, challenging any question from pharmacology can be from that. Right? This is a way to study pharmacology. If you try haphazardly, ye drug, you will not understand anything. Uses, adverse effect, always in the form of the mnemonic you try to mug up. Mechanism of action in the form of the diagram and flowchart. And classification, anyhow, you have to stick on your walls and mug up. Say, yes, got it. So this is a way to study pharmacology, unique way. But believe me, it's the effective way. Anyways, coming on the classification. There are 4 generations of fluoroquinolones. There are 4 generations. First generation, second generation, third generation, fourth generation. The fourth generation is the latest one, and we use them. These are the broadest spectrum. The first generation, they kill only gram-negative cocci. Gram-negative cocci and some gram-negative bacilli. So nalidixic acid and oxalinic acid we do not use nowadays. They kill only gram-negative cocci, hardly any bacteria they kill. Then in the second generation, we have extended gram-negative. यहाँ पे तो gram-negative भी ज़रा से kill कर रहे थे. Hardly any bacteria they were killing. At least they are killing all gram-negative cocci as well as gram-negative bacilli, but none of the gram-positive bacteria they are killing. Right? So here we have 4 drugs. Norflox, Lomeflox, Ciproflox, Oflox, right? So these are better than the first one. In the third generation, they are killing all the gram-negative, है ना? And additionally some gram-positive. Not all gram-positive, but some gram-positive. So they are better, है ना? Here we are having 7 drugs. Levoflox, Parflox, Getiflox, Pflox, Temaflox, Tosuflox, Moxiflox, है ना? So learn their names. And the fourth generation is the best. Why they are best? Because they kill all gram-positive, as well as all gram-negative, as well as anaerobic bacteria also. They kill everyone. And we have only 6 drugs here. The 6 drugs, the best fluoroquinolones. Trovaflox, Pleroflox, Gamiflox, Pruliflox, Sitaflox, and Clinaflox. Make some mnemonic, है ना? And learn it. Make some mnemonic and learn it. So these are the 4th generation, right? So have a look on it, and now have a look on your question. You can easily solve that. Have a look. Which of the following fluoroquinolone have the broadest spectrum? I mean to say, the examiner is asking you which of the following is the 4th generation. Simply 4th generation to rata. First or 4th रट लो. First narrowest spectrum, 4th broadest. Second, third नहीं भी learn किया तो चलेगा. लेकिन 4th spectrum should be at the tip of your tongue. So I guess nalidixic acid is 1st generation. Cipro and Norflox are 3rd generation. Only Trovaflox among them is the 4th generation. Now you can make it out. Say yes. Got it? And instead, if I changing, so currently answer is C. I guess you got it. If I'm changing one word in the question, broadest की जगह मैं narrowest कर दूँ. Would you like to change your answer? Huh? Of course. Would you like to change your answer? Of course. What is the correct answer in that case? The narrowest spectrum will be the 1st generation. In that case, your answer will become me. So changing one word in the question changes the answer. Don't mug up. है ना? तुम question learn करके जाओगे. Examiners are very smart like me. They will change the question to just confuse you. So to judge who is actually understanding the topic and who is just doing the rectification. Got my point? Can we go ahead? This is regarding fluoroquinolones. Learn the fourth generation, learn the mechanism of action. They inhibit DNA gyrase. They inhibit the unwinding step. No unwinding, no replication. They are direct inhibitors of nucleic acid synthesis. Indirect inhibitors, we have seen sulfonamide and trimethoprim. The combination is known as cotrimoxazole, 5:1. Next question is in front of you. Can we start? It's a big topic. Can you read the question? Tell me the answer. We will continue. Which of the following anti-tubercular drug precipitate gout? Now, definitely you are going to get one of the question on ATT. Which one? I don't know. You know, there are 5 ATTs, anti-tubercular drug, which are used in the treatment of the TB. The treatment of the TB is DOTS. So DOTS में आती हैं ये सारी. There are 5 drugs. HRZES. How many of you know that? H is isoniazid, R is rifampicin, Z is pyrazinamide, E is ethambutol, and S is streptomycin. Streptomycin is one of the aminoglycoside, that is one of the protein synthesis inhibitor, right? Rest all are new drugs that I will explain you, right? So these are the 5 drugs that are used in DOTS, है ना? So always you will get one of the question. Very frequently ATT पे question आता है every year. Hardly you will find any question paper जिसमें ATT पे question नहीं है. So you frequently get question on ATT, right? Now which one? Either the question will be on their mechanism of action, or the question will be on their specific properties, or the question will be on their side effects. Currently the question is on side effect. Which of the following ATT causes gout? Gout कौन कराता है? Is it pyrazinamide, rifampicin, streptomycin, or isoniazid? You just read the option. Give me 1 minute. I want to drink water. है ना? Thank you so much for allowing the time me to drink water. Thank you so much. So what is the correct answer? Most of the students are right. The correct answer here is pyrazinamide. Pyrazinamide. So let me explain you everything about ATT drugs, so that any question coming in your exam, you should be able to crack it. Can I start? Let's start ATT, anti-tubercular drugs. So there are 2 types of anti-tubercular drugs, the first line, the second line. First line, I already told you the 5 drugs, the 5 heroes, the 5 main drugs. HRZES, never forget, never. H is isoniazid, R is rifampicin, Z is pyrazinamide, E is ethambutol, and S is streptomycin. These are the first line drugs. Apart from that, we have many second line drugs also, like fluoroquinolones. Just now I taught you fluoroquinolones. These are the drugs that inhibit DNA gyrase enzyme. That is, they inhibit the DNA synthesis directly. These are DNA, nucleic acid synthesis inhibitors. I told you first, second, third, fourth generation. So fluoroquinolones are second line drugs. Apart from that, we have aminoglycoside. In first line also we have one aminoglycoside. So this one is the aminoglycoside. You can see here that is streptomycin. Aminoglycosides are always injectable. I told you there are no oral drugs available. So among the 5 main heroes, one is injectable, remaining 4 are oral. So remaining 4 की tablet आएगी, लेकिन streptomycin का injection होता है. Got my point? And among the injectables, you can see the remaining aminoglycoside, kanamycin, amikacin, capreomycin. This is streptomycin, mycin. So first learn the classification, but here in this session, I am not teaching you the second line drugs. I am teaching you the 5 first line drugs. So please learn HRZES. I want you to make this comparative table with me right now. I am challenging you. If you are a FMGE aspirant, you are going to get 1 question from this table. If I directly show you the table, you don't understand anything, right? Like most of the educators do. But here, one by one, I will explain you the drug, showing the diagram, showing the mechanism of action. In the introduction, we will write the important points of that. Mechanism of action, I will show you all of them in one diagram. Resistance is not important. Pharmacokinetics, some important points are there, and adverse effects, I'm having the mnemonics in most of them. Can we start? Are you people with me? So let's start with isoniazid. It will take hardly 5-6 minutes, but you will definitely get 1 question from that. Can we start? Can we start? Are you people with me? Let's start with isoniazid. So before starting, let me tell you a few common properties of all the 5. Don't change the sequence. Don't dare to change the sequence. It's HRZES always. Learn this in sequence. All of them are CIDL. What do you mean by CIDL? They kill the Mycobacterium TB bacteria. TB कौन कराता है? TB is caused by a bacteria. The name of the bacteria is Mycobacterium tuberculosis. This is the name of the bacteria. So they all kill this bacteria except ethambutol, which do not kill the bacteria. It is static. It inhibits the replication of the bacteria, but remaining all will kill the bacteria. Say yes if you got it. Remaining all kill the bacteria. Got it? Okay, just a second. So all of them are acidyl except ethambutol, which is static. Okay, the first three are hepatotoxic. You can see the first three, they cause hepatic injury, they cause jaundice. But among them, the highest is pyrazinamide. You can see here is 1+1+, and this is maximum. And here the fourth and the fifth, that is ethambutol and streptomycin, are not hepatotoxic. Right now, you have to understand the TB occurs in the lung. Let me draw the lung. In the lung, these are the cells of the lung. Where is the bacteria? Where is the Mycobacterium tuberculosis present? It's extracellular also, it's intracellular also. So bacteria is both extracellular, intracellular. So there are 5 drugs, HRZES, which kill extracellular, which kill intracellular, which kill both. That is also very important questions, right? So H kills both, R also kills both, and E also kills both. H, R and E kill both extracellular as well as intracellular. But pyrazinamide kills only intracellular and streptomycin kills only extracellular. So you frequently get question on pyrazinamide and streptomycin. Please learn that. Please, how you will learn, I don't know, but you have to learn this. There are many questions from this table. Can we start? The 5 drugs, the mechanism of action. So out of the 5, okay, this is a bacteria. The name of this bacteria is Mycobacterium TB. It is having a cell wall. You may have read this in microbiology also. Mycobacterium tuberculosis is the name of the bacteria. It is having a cell wall. The cell wall contains a lipid. It is known as mycolic acid. Mycolic acid is required for cell wall synthesis. If you give any drug that inhibit mycolic acid synthesis, the cell wall will not form and bacteria will die. So out of the 5 drugs, 3 of them inhibit mycolic acid synthesis. Mycolic acid कैसे बनता है? How does the mycolic acid is formed? So mycolic acid बनने के लिए 3 enzymes are required, है ना? Mycolic acid and arabinogalactan. They two combine together and they form the cell wall. Mycolic acid synthesis require FAS1 and FAS2 enzyme, है ना? Fatty acid synthetase 1 and fatty acid synthetase 2 enzyme, and arabinogalactan require arabinosyl transferase enzyme. If these 3 enzymes are present, the cell wall will form, है ना? So what are the drugs? है ना? H, isoniazid inhibit this. है ना? R को छोड़ो, Z, pyrazinamide inhibit FAS1, है ना? और E inhibit arabinosyl transferase, है ना? So if any of them is inhibited, ultimately cell wall will not form and bacteria will die. So out of the 5 drugs, 3, that is H, Z and E, I mean isoniazid, pyrazinamide and ethambutol, they inhibit cell wall synthesis. Got my point? Got my point? Say yes if you got it. So let me draw the diagram of Mycobacterium tuberculosis in front of you. Okay, this is the nucleus, this is the DNA. Okay, and this is the ribosome. Okay, this is a diagram of Mycobacterium TB, which causes TB. Okay, so I want to kill it because my patient, I want to treat my patient and I want to kill it. So I'm having 5 drugs with me. So among the 5 drugs, H, Z and E, they all inhibit cell wall synthesis by inhibiting different enzymes. You have to learn the name of the enzymes also. Z inhibit FAS1, fatty acid synthetase 1. H inhibit FAS2, fatty acid synthetase 2, and ethambutol inhibit arabinosyl galactose enzyme. So no arabinosyl galactose is formed. You got my point? Arabinosyl transferase enzyme. So this is how they inhibit cell wall synthesis, right? Ab rahi baat S ki. So S inhibit, S you already know, S is an aminoglycoside. If it is an aminoglycoside, it is inhibiting protein synthesis on the ribosome, by inhibiting step number 1, initiation. Right, so streptomycin is an aminoglycoside that inhibit protein synthesis. And rahi baat kaun? HR, rifampicin. Rifampicin inhibit RNA synthesis, R for R. Rifampicin inhibit RNA synthesis, DNA to RNA conversion. No DNA to RNA conversion because for DNA to RNA conversion, the enzyme required, that is inhibited by rifampicin. So see the 5 drugs inhibiting different thing in the bacteria. The bacteria is same. The bacteria is Mycobacterium tuberculosis. This is the bacteria, right? I want to kill this bacteria. I want to treat my patient. My patient is having TB. The patient is in front of me. I can give 5 drugs. And the combination of the 5 drugs, H, R, Z, E, S. Out of the 5 drugs, H, Z and E inhibit the cell wall synthesis in the bacteria by inhibiting different enzymes I told you. S inhibit protein synthesis by inhibiting the ribosome, 30S as well as 50S as well as junction of them by inhibiting the first step, initiation. And rifampicin inhibit RNA synthesis, DNA to RNA conversion. Say yes, how many of you got it? How many of you got it? So the mechanism of action of all 5 I told you in one diagram. Okay, I guess you all got it. Now let's start the 5 drugs H, R, Z, E, S one by one very quickly. Let's start the first one, isoniazid. Isoniazid, the H is the first one, right? It is bacteriostatic. It is bacteriostatic. It's bactericidal, we have seen. It kills intra and extra both. It is a drug of choice of TB. It is a drug of choice for profile access of the TB. है ना? Drug of choice of TB, drug of choice of profile. The mechanism of action, it inhibits FAST2. No FAST2, no mycolic acid, no cell wall, bacteria will die. It inhibits cell wall synthesis in short. ठीक है? Adverse effect, है ना? Allergy तो सब में होता है. Don't learn that. It inhibits the enzyme pyridoxal phosphate, है ना? So that's why pyridoxine, it inhibits with the vitamin pyridoxine, है ना? Pyridoxine के absorption को inhibit करेगा. That's why the person will have neuritis. Neural symptoms होंगे. Neuritis, sensory deficit and neuritis is there. So that is due to pyridoxine deficiency. ठीक है? Hepatitis करेगा. Hepatitis, it causes hepatitis. I told you ना, the first 3 drugs causes hepatitis. See, you can see it here. Hepatitis, the first 3 drugs, H, R, Z, they all cause. तो hepatitis तो है ही है. उसके अलावा pyridoxine deficiency और उसके अलावा hemolysis and G6PD deficiency. So that's the 3 side effects you have to learn. The next is the rifampicin. Rifampicin is also bactericidal. It also kills both extra and intra. It is the most potent drug among the 5. पांचों में से earliest acting is this. Earliest ये है, लेकिन most potent ये है. दो अलग अलग क्वेश्चन है, दो अलग अलग आंसर. If they are asking earliest anti-TB drug to act, answer is isoniazid. If they ask you drug of choice, answer is isoniazid. But if they ask you the most potent one, answer is rifampicin. You can see, and all of them are cidal except ethambutol, which is static. And the first 3 causes hepatitis. So rifampicin also causes hepatitis. What is the mechanism of action? I told you it inhibits RNA synthesis. RNA synthesis, DNA to RNA conversion नहीं होगा. So for that an enzyme is required, DNA dependent RNA polymerase. So this is the bacteria, this is the nucleus, this is the DNA. The 2 strands of the DNA get separated, leading and lagging. On the leading strand, the mRNA gets synthesized. On the leading strand, so DNA to mRNA conversion. Can you see? This is DNA. DNA से बन रहा है RNA. For this an enzyme is required. What is the name of the enzyme? What is the name of the enzyme? DNA dependent RNA polymerase. Say it again. It is not opposite. You will get one of the option as RNA dependent DNA polymerase. नहीं जी. It is DNA dependent RNA polymerase. है ना? This enzyme is inhibited by rifampicin. So no enzyme, no conversion, no RNA formation. Bacteria will die. Bacteria will die. It's cidal. So this is the mechanism of action of rifampicin. R for R. Rifampicin inhibit RNA synthesis. Always learn that. Adverse effect very unique, है ना? It gives everything orange color, है ना? All the secretions, the tears will be red to orange, the urine will be red to orange, but it's harmless. So patient will take the drug and the saliva will be red to orange. So patient will feel the blood is coming out of the ear, the eyes, है ना? Tears are bloody. The saliva become red, it's become bloody. In the urine, it's red. So warn the patient that your urine, saliva, all the secretions, tears are going to be red to orange, but it's harmless. It's harmless. Just a color is there. So rifampicin, very important PYQ. Hepatitis first 3 कराते हैं तो ये भी कराता है ना? So only these 2 important things are there. The third one is the pyrazinamide. Pyrazinamide, Z, है ना? Z. It kills only intra. I told you ना? You can see this one is killing only intra. This was killing only extra, intra both. This one also killing extra, intracellular bacteria both. This one kill only intra. This is also cidal. And the mechanism of action I already told you. It inhibits FAST1. Isoniazid was inhibiting FAST2. Fatty acyl synthetase, and this one is inhibiting FAST1. अब FAST1 inhibit हो या FAST2 हो, ultimately mycolic acid is not formed, cell wall is not formed, bacteria will die. You got my point? This is the mechanism of action. Adverse effect, this is most hepatotoxic. भाई hepatotoxic तो तीनों है, first, third, लेकिन most hepatotoxic is this one. This causes gout. This causes gout. That is our question right now. This causes gout, और gout की वजह से patient को होगा arthralgia. हाइपर यूरिसीमिया ये कराएगा. ब्लड में यूरिक एसिड बढ़ जाएगा तो पेशेंट को हो जाएगा गाउट. यू नो गाउट क्यों होता है? व्हाई डज गाउट अकर? बिकॉज ऑफ इंक्रीज यूरिक एसिड कंसंट्रेशन इन द ब्लड. So increased uric acid concentration leads to gout, and that leads to arthralgia. The next is ethambutol, the fourth one, HRZE. The fourth one is the ethambutol, the only one which is static. इस पे एक ही क्वेश्चन आता है static, बाकी सब सिडल हैं. Rest all kill the bacteria. This one do not kill the bacteria. This one inhibit the replication in the bacteria. है ना? This is least toxic among all. So most earliest to act, this one. Most potent, this one. Least toxic, this one. So please learn main. Drug of choice is isoniazid. So please learn the one-liners on them. The mechanism of action you already know. It inhibits the enzyme arabinosyl transferase. No arabinosyl transferase, no arabinogalactone, no cell wall. So ultimately no cell wall. So we have seen the three drugs which inhibit cell wall synthesis. The isoniazid, the pyrazinamide and the ethambutol. They inhibit the cell wall synthesis. And adverse effect, very unique adverse effect, optic neuritis. Optic neuritis. The patient have color blindness. The patient will have green vision, color blindness, है ना? But it is reversible at early stage. You stop the drug, it is reversible. Got it? It also causes gout. Increase uric acid and causes gout, right? And the last one is the streptomycin, है ना? So it is the streptomycin only injectable among the 5. Mechanism of action, you already know, it acts on the ribosome and inhibit the P window, inhibit the initiation. Okay, it is also 𝗲𝗏 and it kills only extracellular. And side effects, you also know, it's on HT. I already told you. 𝗏𝗏NHT, ototoxicity, nephrotoxicity, neuromuscular toxicity, hypersensitivity and teratogenic. That's the thing. Got it? Say yes if you got it. Got it? Do you have any confusion? So can we revise the 5 drugs together quickly? Quickly. Who will help me for this? Let me ask you the questions. H, R, Z, E and S. Okay, let me ask you a specific question. You give specific answer. Which of them are 𝗲𝗏 and which of them are static? मेरा पहला question. ठीक है? Which of them causes hepatitis? मेरा दूसरा question. Which of them causes gout? मेरा तीसरा question. है ना? 3 of them causes hepatitis and 2 of them causes gout. What is the mechanism of action of each of them? Right? मेरा next question. Which of them kill extracellular or intracellular bacteria? Which kill extracellular bacteria? Which kill intracellular bacteria? Last, स्पेसिफिक एडवर्स इफेक्ट, जो स्पेसिफिक है. एलर्जी तो सब में होती है, उसके अलावा स्पेसिफिक क्या क्या है वो बताओ. So 2 specific adverse effects of each of them. So this if you have done now, you are definitely going to get a question on that. Okay, so please tell me, all of them are 𝗲𝗏 except ethambutol, which is static. Am I right? Kindly respond, people. You're not deaf dumb. Respond in the class. So static is only ethambutol. What about hepatotoxicity? The first 3 are hepatotoxic. Among them also the third one is highest, है ना? So Z more than R more than H. H is least hepatotoxic, Z is most hepatotoxic. These 2 are not hepatotoxic. No, not hepatotoxic. Regarding gout, the third and the fourth. This one is having gout, this one is having gout. These didn't have. So gout में ये 2 आएंगे. Fourth, third and fourth. That is pyrazinamide and ethambutol. If you don't change the sequence, things are very simple. Hepatitis in the first 3. And gout in the third and the fourth. Please learn. Our question is on gout right now. है ना? The third and the fourth causes gout. Mechanism of action, I already told you. This one inhibits cell wall synthesis by inhibiting the enzyme FAST2. This one inhibits RNA synthesis by inhibiting the enzyme DNA-dependent RNA polymerase. DNA-dependent RNA polymerase is the name of enzyme. This one also inhibits cell wall synthesis by inhibiting FAST1. This one also inhibits cell wall synthesis by inhibiting the enzyme arabinosyl transferase. And this one inhibits protein synthesis by inhibiting the initiation. Anna, this is how you have to write as quickly as possible. Appreciate. So all of this one, it kill both the bacteria, intra-extra. This one also kill both intra-extra, and the ethambutol also kill both intra-extra. Pyrazinamide kill only intracellular, streptomycin kill only extracellular. That is our question. Adverse effect, specific adverse effect. So यहाँ पे specific adverse effect, one of them is pyridoxine deficiency, है ना? Pyridoxine deficiency is specific, and hepatitis is already there. I told you, so I'm not repeating it. And apart from that, G6PD deficiency में hemolysis. ठीक है? Here the main side effect in rifampicin is orange, red-orange color in the secretions. That's the tagus. And hepatitis you already know. Pyrazinamide में it's gout, ethambutol में it's gout, but along with the gout it's optic neuritis also. And streptomycin में 𝗏𝗏NHT. I guess you know the full form. I tried hard. 2-3 students are responding while rest are sleeping. Kindly appreciate. You got it. At least appreciate that you got it. You don't have any confusion. You get many questions on ATT, right? So that is the ATT. So let's go ahead. Coming on the next topic. The next question is in front of you. The next topic. The next question is in front of you. The question is on enalapril. Pril is one of the ACE inhibitors. So the question is on ACE inhibitor. Now we will see everything about the ACE inhibitors. Enalapril is contraindicated in all of the following except. The question is regarding except. Can you tell me what is the correct answer? Is it diabetic nephropathy with albuminuria? Is it single kidney? Is it bilateral renal artery stenosis or hyperkalemia? For this, you have to understand the ACE inhibitors in detail. Everything about ACE inhibitor. Why? The drugs, the mechanism of action, the uses, the side effects. Side effects से ही निकलेंगे contraindication and important points. यही 5-6 हेडिंग में पूरी फार्माकोलॉजी खत्म हो जाती है. Got my point? Huh? What is the correct answer? The correct answer is A. Absolutely right, KPS. Let me explain you. I will come on the question again. Let me explain you. So how many ACE inhibitors you know? They all are prils. So you have 8 ACE inhibitor. They are pril. So it's captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinapril, and prandolapril. So don't add pril after your name. You have to learn the prefix also. Suffix is pril, everyone knows. Suffix is pril. All of them are pro-drug except two. Which two I told you at the beginning when I taught you pro-drug. Captopril and lisinopril are not pro-drug. Rest all are pro-drug. I told you. इस पे बहुत question आता है. ठीक है. So learn the classification. चलो जी, classification तो हो गया. Now what is the mechanism of action? What is the mechanism of action? You have to understand the renin-angiotensinogen pathway. If you want to understand the mechanism of action of ACE inhibitor, first you have to understand ACE क्या होता है. हाँ, तभी तो ACE inhibitor समझ में आएगा ना. I am teaching you ACE inhibitor. तो भाई ACE क्या होता है? What is ACE? ACE is an enzyme. कहाँ लगता है ACE enzyme? हमारी human body में where it is present? ACE enzyme. So ACE enzyme is a component of a family. The name of the family is renin-angiotensinogen pathway. So we all have blood pressure. We all have blood, of course, in our blood vessels, and we have a normal blood pressure whenever our heart is doing systole and diastole normally. So normal blood pressure is 120/80. We all know that, systolic, diastolic. So whenever the heart is doing systole, at that point blood pressure is 120. Whenever the heart is doing diastole, at that point the blood pressure is 80. So this is normal. But imagine if someone is having low blood pressure due to anything. Just suppose the person is just getting up from prone to supine position, very quickly, or the person is vomiting, diarrhea, accident, bleeding. Due to any reason, if there is low blood pressure, there is a backup mechanism God has given to increase the blood pressure and becoming normal again. Yes, God has given a backup mechanism in all. God is great. He has given a compensatory mechanism in human body. Whenever we have fall in blood pressure in our blood, there is a family which get activated, which is known as renin-angiotensinogen pathway, renin-angiotensinogen system. It is having multiple enzymes and proteins inside that. That's why it's a family. Let me tell you, whenever there is a fall in blood pressure, so the liver synthesizes a protein. You can see this is the liver. The liver synthesizes a protein. The name of the protein is angiotensinogen. It is always present in my blood, your blood, but currently it is not active because my blood pressure, if you measure, it's normal. But due to any reason, if my blood pressure will fall, the kidney, inside the kidney there is juxtaglomerular cells are there. They will secrete an enzyme. The name of the enzyme is renin. Renin immediately convert angiotensinogen to angiotensin 1. This is the function of the renin. Renin is secreted by the kidney. The angiotensinogen is a protein. Angiotensin 1 is a protein, but the conversion of these protein is requiring an enzyme. The name of the enzyme is renin. Renin is secreted by kidney. Now angiotensin 1 is not very active. It is active but 20-30%, not very active, right? We want to convert it into angiotensin 2, right? So we want another enzyme. The name of enzyme is angiotensin converting enzyme. Say the full form. Say the full form. It's angiotensin converting enzyme because it is converting angiotensin 1 to 2. As simple as that. So angiotensin 1 to 2 is converted by angiotensin converting enzyme, that is ACE, and it is secreted by lungs. So see how many organs are involved, right? So lung will secrete this enzyme and it will convert angiotensin 1 to 2. Now this angiotensin 2 will act on 6 different organs of human body and it will increase the blood pressure again, right? It will act on the blood vessel causing vasoconstriction in them. So blood pressure will increase. It will act in the heart and increases the contractility. So blood pressure will increase. It will act on the kidney doing sodium water retention. So again the blood pressure will increase. It will act on the adrenal gland and causes angiotensin release. So again the blood pressure will increase. It will act on the brain. It stimulates the thirst center in the brain. So person will drink more and more fluid. So BP will increase. So the main purpose of this all is again increasing the blood pressure. You got my point? Say yes if you got it. So whenever we have decreased BP due to any reason, God has given a family with us. In this family there are 3 protein, 1, 2, 3 and 2 enzyme. What are the name of the 2 enzymes please? Renin and ACE. The renin is secreted by kidney and the ACE is secreted by lungs. And we have 3 proteins, angiotensinogen, angiotensin 1 and angiotensin 2. You can see. So whenever we have fall in BP due to any reason, the angiotensinogen, which is secreted by the liver, present in the blood, in all of our blood it is already present. So due to any reason, imagine my BP falls, if vomiting, diarrhea, dehydration, bleeding, due to any reason, an accident. So angiotensinogen 2 will be converted to angiotensin 1, angiotensin 1 will be converted to angiotensin 2. For these 2 reaction, 2 enzymes are required. First renin, which is secreted by kidney, then ACE, which is secreted by the lung. Angiotensin 2 will show its action on the 6 organs and increases the BP. Again, by increasing, the BP will become normal. Got it? But angiotensin 2, then it will convert into angiotensin 2, 3 and 4 and get excreted out of the body after showing its action, right? Now, this is the complete story. This is the complete story. Now, you will say, ma'am, what is a drug? What is the drug, this ACE inhibitors we are talking about? Now, in old age, you may have seen after 50 years of age or after 60 years of age, 90% of the patients have, 90% of the persons have hypertension. How many of you have your parents having, one of the parent or both the parents or grandparents, definitely they have hypertension. They may be on antihypertensive drugs. How many? I guess many of us, right? So 80% of the people have hypertension after 50 or 60 years of age. So why? You may have think, oh, why? क्यों hypertension हो जाता है एक age के बाद? Why? So because in old age, this system become inactive. I mean, even at normal BP. Now this family come in activation whenever there is low BP. Even at normal BP, this become active. This system become active. Angiotensinogen converted to angiotensin 1, angiotensin 1 to converted to, because renin will come in the blood and ACE will come in the blood, right? And angiotensin 2 will act on the 6th organ and increase the BP. So the person will have hypertension. We want, whenever the person have low BP, we want this family to come in action. We want the RAS family to come in action and increases the blood pressure. Whenever low BP is there, they increase the blood pressure become normal. We want this. This is useful. But whenever there is a normal blood pressure, we do not want them to get active. We want them to be silent. We do not want. But sometimes even on normal blood pressure, this family become active, especially in old age. And normal BP, again, once it will become active, it will increase the blood pressure by acting on the 6th organ. So here the person will have hypertension. The person will have hypertension in old age, right? So low BP को normal कर देगा, लेकिन normal BP को high कर देगा, ये system है ना? Low को normal तो हम चाहते हैं, लेकिन normal को high नहीं चाहते. But in old age it occurs. Imagine in my clinic today there is a old person. Today there is a 60-year-old person. The person is having headache. I measure the blood pressure. It is 140 by 100, something like that, and constantly it is elevated. So I will ask the person. The person is having hypertension. I will label the person is having hypertension. I want to treat it. Being a doctor, what drug should I do? So hypertension किसने कराया? Hypertension कराया. Hypertension क्यों हुआ? So if I understand the mechanism of hypertension, I can treat it. Hypertension is due to activation of the system. So if I inhibit the system at any level, the hypertension will be treated. So ACE inhibitor. I am giving the drug ACE inhibitor. This is the role of ACE inhibitor. ACE inhibitor क्या करेगा? ACE inhibitor will inhibit the ACE. No ACE, so angiotensin 1 cannot be converted to angiotensin 2. Angiotensin 2 will not form. It will not act on the 6th organ. No hypertension. So this is the mechanism of action of ACE inhibitor. It is the main use is hypertension. Yes, renin inhibitors also we can give. 𝗙𝗲𝗃𝗃, absolutely right. So renin inhibitors we can give. ACE inhibitors we can give. There are many levels we can block. But currently my topic of concern is ACE inhibitor. So this is an overview कि भाई ACE inhibitor लगता क्यों है? Students used to mug up ACE inhibitor. उनको पता ही नहीं है कि ACE inhibitor का function क्या है. So ACE inhibitor is inhibiting the enzyme ACE, right? But why this enzyme? I told you, now this enzyme is present in the lungs. Why God has given this enzyme in the lungs? What is their normal function? Whenever there is low BP, it is coming in the blood. Otherwise, what it is doing? Otherwise, in the lung, in my lung, ACE is present. In your lung, ACE is present. We all have ACE in our lungs. In our lungs, bradykinin is formed constantly. That causes cough. So it degrades the ACE degrade the bradykinin into inactive products. So that's why we don't have cough. Otherwise, bradykinin is constantly produced in our lungs as a byproduct. If ACE is not there, now we can have cough. So my point is that ACE inhibitors का side effect is cough. So ACE inhibitor का दो function है. ACE का दो function है, not ACE inhibitor. What is the two functions of the ACE? See the beautiful diagram I have drawn. This is ACE enzyme. It is doing two functions. What the two functions it is having? Normally in the lungs, it converts bradykinin into inactive substance and prevent the cough. So it is useful for us, है ना? But during whenever there is fall in BP, at that time only it is converting angiotensin 1 to 2. It is also useful to us, है ना? If you give ACE inhibitor, both these functions will be blocked. We want the blockage of this function. Yes, we do not want angiotensin 1 to convert it into angiotensin 2 because we want to treat the hypertension, right? But if we inhibit the ACE, this will also block and the person will have cough as a side effect. So cough and edema is a side effect of ACE inhibitor because bradykinin causes cough, edema, itching, all of them. So this is the side effects also I have explained you. Got it? Say yes if you got it. Can we go ahead? Can we go ahead? So this is the complete story of the ACE inhibitors, the mechanism of action of the ACE inhibitors I told you. If you inhibit the ACE, both the functions will be blocked. This we want, but this we do not want. This is a side effect. So this is the effect of ACE inhibitor and this is the side effect of ACE inhibitor. है ना? Effect angiotensin 2 is not formed, hypertension is treated. And side effect, bradykinin will not get secreted, it will lead to cough, edema, itching. Kindly respond, say something. You got it? So this is the mechanism of action. Now coming on the uses. How many uses of ACE inhibitors you know? Tell me the uses of the ACE inhibitors. So there are 6 uses of ACE inhibitor. I am having a mnemonic for you. The mnemonic is home care makes patient definitely strong. This is the mnemonic. Home care makes patient definitely strong. H for hypertension, that is the main use as an antihypertensive drug. For hypertension, we are having 4 first-line drugs, A, B, C, D. A, B, C, D. A is ACE inhibitor, B is beta blocker, C is calcium channel blocker, and D is diuretic. These all are first-line drugs for hypertension. Depending on patient to patient, you have to decide your best drug for the hypertension, right? If not contraindicated, the first drug we start is always ACE inhibitors. Okay. C is congestive heart failure. M is MI, myocardial infarction ke treatment may be, and as a prophylaxis B, prophylaxis of MI. Just suppose I am having a lady who is obese, who is diabetic, high chances, physically inactive, high chances in future she can have MI. So I can give as a prophylaxis also ACE inhibitor. So MI, after MI, before MI as a prophylaxis. D is diabetic nephropathy. Diabetic nephropathy, and S is scleroderma. Scleroderma may be hypertension is there, and a severe hypertension crisis is there. So that is scleroderma, है ना? So please learn the uses are in front of you. Okay, this the uses. Now the side effect of the ACE inhibitor. How many side effects you know? ACE inhibitor, there is a mnemonic. The mnemonic is captopril. Captopril ही mnemonic है. Captopril is one of the side effect, one of the ACE inhibitor ना. CAPTOPRIL. So C stands for cough, A stands for edema, I stands for itch. These 3 side effects are because of bradykinin. Bradykinin is not degraded now. That's why it is causing cough, edema, and itching. P stands for proteinuria. है ना? Protein will be excreted out of the urine. ठीक है? T is teratogenic. Teratogenic. O में कुछ खास नहीं है. Just to complete the mnemonic, I included O. O is others. P is potassium will increase. R is renal impairment, and L is low BP. है ना? If you give high dose in the first dose, the complete dose as a first dose, so instead of normalizing, it will fall the BP. है ना? So एकदम से patient को चक्कर आ सकते हैं. So start gradually increase the dose. So this is the side effects. The contraindication are 4. The mnemonic is PARC. PARC. P for pregnancy, A for allergy, R for renal artery stenosis. That is our question right now. And K is potassium. Potassium को K बोलते हैं ना? Hyperkalemia is contraindication. So tell me everything about ACE inhibitors. Tell me 3 things about ACE inhibitors. Tell me its mechanism of action, uses, adverse effects, contraindication. Who will tell me? What is the mechanism of action? ACE inhibitors inhibit ACE. Of course, it inhibits the enzyme ACE. So angiotensin 1 cannot be converted to angiotensin 2. So angiotensin 2 level in the blood will fall. Angiotensin level in the blood will rise. Angiotensin 2 will fall, right? And that is the mechanism of action. Uses may home care makes patient definitely strong. Say the full form. H for hypertension, C for congestive heart failure, M for MI, P for prophylaxis of MI, D for diabetic nephropathy, and S for scleroderma. Okay, what are the adverse effects? Captopril. CAPTOPRIL. Please learn. The most important is cough, angioneuritic edema, and itch. That is caused by bradykinin. Okay. Contraindication you must learn as PARC. PARK. Never forget. So it's pregnancy. Pregnancy. A is allergy, I guess. R is renal artery stenosis, and K is hyperkalemia, hyperpotassium. So please learn. Please learn. The uses home care makes patient definitely strong. Adverse effect is captopril, CAPTOPRIL, and contraindication is PARC. All 3 things I have given you the mnemonic. Got it? So now you can solve your question very easily. Have a look on the question. We have done everything about the ACE inhibitor. ACE inhibitor by question, and you know the classification also. The suffix is the pril. All of them are prodrug except captopril, lisinopril. So classification भी पता है, mechanism of action भी पता है, uses भी पता है, side effect भी पता है, contraindication भी पता है. तो कुछ भी question आ जाए, you can solve it. Now have a look on the question and tell me the correct answer. Yes, what is the correct answer? What is the correct answer? Enalapril is contraindicated in all of the following except the first thing. Enalapril is a ACE inhibitor. The first thing, enalapril is a ACE inhibitor. So the mnemonic is PARK, na? PARK, है So renal artery stenosis is coming, hyperkalemia is coming, single kidney is not coming, but it is also a side effect, contraindication. But diabetic nephropathy तो uses में आ रहा है ना? Home care makes patient definitely strong का D क्या है? Diabetic nephropathy. तो ये तो use है, contraindication नहीं है. Correct answer is A. I hope you got it. I tried my best to explain you everything about the ACE inhibitor. Coming on the next question is one of the important drug, that is digitalis. One of the inotropic drug, one of the drug of the heart failure. Digitalis के बारे में अब हम सब देखेंगे. What is the mechanism of action of the digitalis? What is the mechanism of action of digitalis? Is it inhibits sodium potassium ATPase pump? It inhibits sodium hydrogen ATPase pump. It activates metabolite. The active metabolites are produced in the liver, or it inhibits calcium concentration in the blood. So what is the correct answer? Can you please tell me? Yes, what is the correct answer? Can you please try this question? Yes, the correct answer, you are right. It inhibits sodium potassium ATPase pump. So let me explain you the mechanism of action of the digitalis. Digitalis is one of the inotropic drug. You can see digitalis is one of the cardiac glycoside. It is an inotropic drug. It is a drug of heart failure. What is heart failure? In the heart failure, the right ventricle or the left ventricle, it is not pumping. The left ventricle is not pumping. What will happen if the left ventricle is not pumping? Blood is not coming in aorta. Blood is not coming in the aorta. So all the organs are not receiving the pure blood. This disease is known as heart failure. The heart is in failure and the person can die. So blood is not going ahead. This is forward failure. Where does the blood go? It is not going forward. So where does it go? It is going backward. So from left ventricle it is going to left auricle. From left auricle it is going to pulmonary vein. From pulmonary vein it is going in the lungs and accumulating in the lungs, causing pulmonary edema. The pulmonary edema, pulmonary congestion is there, which leads to dyspnea. So this is heart failure. This is backward failure. So in heart failure, symptoms occur due to two reasons. The blood cannot move forward, this is a reason, and the blood is moving backward, this is a reason. And a heart failure, so two symptoms are there because the left ventricle is not pumping. So we want to treat it. There is a patient in my clinic who is having dyspnea and who is having fatigue because blood is not moving forward now. Most sensitive organ which do not receive blood is brain. Patient can become unconscious in 8 minutes, right? And patient can go in coma and death can occur. The second most sensitive organ is the kidney. Patient can go in acute renal failure and oliguria can occur. Okay, so kidney, patient have oliguria, patient have renal failure, patient is unconscious. That is forward failure symptoms. And backward failure symptoms में एक ही symptom है, patient have dyspnea. So we want to treat this patient. So ultimately what do we want? We want the heart to pump again. हम चाहते हैं heart की pumping start हो जाए. We want this heart to start the pumping again. Got it? We want the heart to start the pumping again. How does it can happen? So the cells present in the myocardium of the heart. Let me show you the myocardium of the heart. These are myocardiocytes. So whenever these cells do contraction, systole occurs. Whenever these cells do relaxation, diastole occurs. So we want to increase the contraction of these cells. If we, by any drug, if we can increase the contraction of the wall of the myocardial cells and cardiomyocytes, so we can increase the systole. We can increase the intensity, the duration of the systole. So digitalis is one of the drug. It is known as inotropic drug that increases the contraction. Okay, so let's start digitalis. You got my point? So this cell shown to you, can you see a cell membrane here in this diagram? You can see a cell membrane. The yellow color cell is shown to you. This is a cell membrane as yellow color cell. So this is one of the cell of cardiomyocyte. Anna, you must imagine we are talking about this cell, the myocardial cell. It is drawn to you. So I will show you normal. How does systole occur? How does diastole occur? If you can understand normal, you can understand how digitalis increases the systole but not diastole. That is the mechanism of action of digitalis. It's an inotropic drug. It's a drug which is used in heart failure. Got it? Huh? Got it? Yes. So let me explain you. You can see it is a cell in front of you. On the cell, how does normally? So normally when depolarization occurs, systole occurs. When repolarization occurs, diastole occurs. So during depolarization, you know, there is a pacemaker. The pacemaker is present in left auricle. From the left auricle, the waves are started from the pacemaker. Hai na? When the wave of depolarization come over this left ventricle, it starts systole. So as soon as the wave is coming over here, the depolarization start. So what happens now? Here there is a calcium channel. Can you see? This is a calcium channel. It will open and hardly a small amount of calcium will enter. It is known as 1% of the calcium. 1% of the calcium will enter inside this cell, and after entering inside this cell, the 1% of the calcium, it will go to endoplasmic reticulum of this cell. On the endoplasmic reticulum, there is a receptor which is known as Raynaud receptor, RYR. Raynaud calcium receptor, RYR. So this small calcium will go to Raynaud receptor, stimulate the Raynaud receptor, and abundant of calcium is secreted from the endoplasmic reticulum. 99% of the calcium will come from here. So total 100% of calcium is present in the cytoplasm of the cell. So in the cell, 100% of the calcium is present in cytoplasm of the cell. Let me draw the cell completely in front of you to have a better understanding. This is the cell I am drawing. This is cardiac myocardiocyte, the myocardial cell. So I want to do the systole. How does the systole occur? When the wave of depolarization coming here, the voltage gated calcium channels get stimulated. A small amount of calcium will enter inside. A small amount, 1% of the calcium will go inside. After going inside, this calcium is going to endoplasmic reticulum and a sarcoplasmic reticulum. Here RYR, Raynaud calcium receptors are present. So this calcium will go and stimulate the RYR. So from this abundant of calcium will come out. 99% of the calcium will come out and cytoplasm is flooded with calcium. This calcium will go to actin and myosin, causes the contraction, coupling of actin and myosin, and because of which the contraction will occur. So systole is done. Systole is done. This is how systole done. Systole done, right? Now after systole, the wave of depolarization is gone. Now it's time to repolarize. I mean, it's time to do the diastole. How to do the diastole? How to do the diastole? We have to take the calcium away. है ना? जिसने जो दिया वो वापस ले लो, है ना? So take this 1% away again and take this 99% away again, right? So as soon as the contraction is done, on the sarcoplasmic reticulum, there is another receptor which is known as 𝗓𝗏. 𝗓𝗏 will take the 99% back. Whatever इन्होंने दिया ये बोलेंगे हमारा हमको वापस कर दो. हिंदी में कहें तो हमने 99% contribute किया, हमारा हमको 99% वापस कर दो. So this 𝗓𝗏 will take whatever given by RYR, Raynaud. So whatever given by RYR taken back by the 𝗓𝗏, है ना? So 99 is gone. There is no problem. ये 1% है ना, वही trouble देगा. So this 1% is present. Now we want to take the 1% out, which is coming from the calcium channel. We want to take it out. So there is a exchanger, है ना? It is known as sodium calcium exchanger, NCX, present on the cell membrane, है ना? So this 1% calcium is going to this NCX, है ना? Can you take me out? My job is done. I was there to do the systole. Systole is done. Now there is systole is done. Now there is diastole. So can you please take me out? So this will say, okay, I will take you out, but exchange of that, I will take the sodium in. So calcium will go out, but sodium will come in. तो इस sodium का क्या करें? हाँ, इस sodium का क्या करें? So there is another receptor that is known as sodium potassium ATPase channel. Sodium potassium ATPase channel. So this sodium will go out of the sodium potassium and potassium will come in and potassium will remain there. So this is the complete story. So diastole occur. Now again systole occur, again diastole occur. Hana, this is the complete story. Now digitalis, what does the digitalis do? Please understand. Digitalis क्या करता है? Digitalis inhibit this sodium potassium ATPase channel. So start with the systole. Start with the systole again. Start your story. So as soon as the wave of depolarization is coming, 1% calcium will come here. You will say, ma'am, it's okay. 1% is coming. It is going to RYR as usual. RYR, Raynaud will get stimulated. It is secreting 99%. So in the cytoplasm, 100% calcium is there. It is going to actin, myosin, causing coupling, causing contraction. There is no problem in that, right? Now at the time of relaxation, there is a problem. There is a problem. Whatever 99 given is taken back by the 𝗓𝗏. Whatever Raynaud is given back by the 𝗓𝗏. But here now the remaining 1% want to go out. So it is requesting NCX. Can you take me out? But NCX is saying no, I cannot take you out. Because if I take you out, I have to take sodium in. Anna? So sodium, whatever it was coming till now, it was going back for sodium potassium ATPase channel. But now there is a drug digitalis that has already blocked sodium potassium ATPase. So sodium potassium ATPase is not functional. So if I take you out, so sodium ka kya hoga? Sodium will come in. So I cannot take you out, you remain inside only. So this 1% calcium again go to RYR and stimulate it and causing contraction again and again. I mean to say the contraction is prolonged. And this is how by increasing the duration of the contraction, it is causing systole. How many of you got it? It was difficult, but I tried my best. This is how it is causing the systole. So this is the complete story. Got it? So what the digitalis is doing? Let me explain you just a second. Digitalis inhibits sodium potassium ATPase. So sodium cannot go out of sodium calcium exchanger. So intracellular sodium will increase. Sodium calcium exchanger will not function and 1% calcium will remain inside only. That again and again stimulates sarcoplasmic reticulum, that is endoplasmic reticulum, RYR receptor, and again contraction occur, actin myosin coupling contraction occurs, and this will increase the contraction. Got it? Got it? Coming on the next question. Okay, that was about the mechanism of action of digitalis. You get many questions on that. So coming on the next question is in front of you. What is the mechanism of action of M2 cholinergic receptors? M2 कहाँ पे होते हैं? There are three type of muscarinic receptor, ना M1, M2, M3. You know the location of M2 and what is its action? Skeletal muscle contraction, acid secretion in the stomach, decreased heart rate, or salivary or lacrimation. Tell me their location. They are present on skeletal muscle, they are present in stomach, they are present over heart, or they are present over glands. And what is their action? I'm waiting for your answer. Anyone can answer? 𝗙𝗪, 𝗵𝗵, 𝗵𝗃, KPS, anyone? The students who are attending live. Anyone can answer? What is the correct answer? It's very easy question and commonly asked question. Yes, the correct answer, it decreases the heart rate. It present. So it's time to see all about ANS, autonomic nervous system. What is autonomic nervous system? How many of you understand autonomic nervous system hota kya hai? Okay, in the central nervous system, we have brain and spinal cord. See the simplest version. See, in the autonomic nervous system, I will come on that. Before that, see the central nervous system. Central nervous system kya hota hai? We all know central nervous system and brain and spinal cord. There is a brain, there is spinal cord. What is peripheral nervous system? The nerves coming out of the brain and spinal cord form the peripheral nervous system. So the nerves coming out of the brain are cranial nerves, and the nerves coming out of the spinal cord, these are cranial nerves, these are spinal nerves. So how many cranial nerves human have? How many spinal nerves human have? I guess it's a pada na physiology mein, you have read all this. There are 12 pairs of cranial nerves and 31 pairs of spinal nerves. You can see the red one are the cranial nerves, the blue one are the spinal nerves. So cranial nerves are 12 in number. You know now number 1, 2, 3. You have read everything in the anatomy, I guess. And 31 pairs of spinal nerves are there, out of which 8 are cervical, 12 are thoracic, 5 are lumbar, 5 are sacral, and 1 is coccygeal. You can add, total is 31, right? So we have cranial and spinal nerve. The nerves are of two types, sensory and motor. What do you mean by sensory and motor? So this is the organ. This is the organ. The nerve which is carrying signal from the organ to the CNS is sensory. Sensory is known as afferent. And the nerve which is carrying the signal from the central nervous system towards the organ, see the arrow, these are motor. Motor is efferent. I am interested in motor. To explain you the autonomic nervous system, I am interested in motor, not in sensory. So there are two types of nerve, the sensory and motor. The motor are again of two types. I am interested only in motor. See, these are the types of the motor. They all are motor. So let me mark the arrow. These all are motor. See the arrow. They are carrying the signal from the central nervous system towards the organ. Now you will say, ma'am, how many types of efferent are there? These are the types of the efferent nerve, or these are the types of motor nerve. Got it? So it depends on the organ of the supply. If the organ of the supply is skeletal muscle, it is known as somatic motor nerve, somatic efferent nerve. Efferent or motor ek hi baat hai. Got it? And if the organ of the supply is a smooth muscle, that is involuntary. You know voluntary and involuntary. Voluntary is according to my wish. I can contract, I can relax, meri mercy. Hai na? But involuntary is not my wish. I cannot stop my heartbeat according to my wish. I cannot start it. Hai na? It is involuntary. The peristalsis is involuntary. The lung respiration is involuntary. The involuntary muscles are smooth muscle. The nerve supplying the involuntary muscle, that is smooth muscle, are known as autonomic. So currently we are dealing with autonomic nervous system. Students even don't have concept ki bhai autonomic hota kya hai. First understand what is central nervous system. The brain and the spinal cord. Central nervous system se the nerves are coming out. You can see the central nervous system is the brain and spinal cord. What is peripheral nervous system? The nerves coming out of that. The nerve coming out of the brain is cranial nerve. The nerve coming out of spinal cord is spinal nerve. In humans, there are 12 pairs of cranial and 31 pairs of spinal. You can see the 12 pairs of cranial, you can see the 31 pairs of spinal nerves, right? Now, nerves are of two types, the sensory and the motor. Sensory carries signal from organ towards the central nervous system. Motor is interested. I am interested in motor. The motor is carrying the signal from central nervous system towards the organ. Motor is efferent. Motor is efferent and it is of two types, somatic and autonomic, depending to which organ it is supplying. If it is supplying to skeletal muscle, that is voluntary, it's somatic. And if it is supplying to smooth muscle or involuntary, it is autonomic. Got my point? So that is the thing. Now come on the somatic. Somatic is only one nerve. Can you see it is starting? Everyone have a look here. Please have a look what I am showing you. It's the basics. If you understand the basics, the ANS becomes super fun for you. See, somatic is only one. Only one. It is starting from central nervous system and ending the skeletal muscle. Only one is there. There are not two neurons. Only one neuron is there. But autonomic, there are two neurons. Preganglion, postganglion. At the junction is known as ganglion. It's preganglion and postganglion. The junction is the ganglion. So you can see in the somatic, there is only one, but in autonomic, there are two. And the junction is the ganglion. Now this is known as pre, this is known as post. This is known as pre, this is known as post. The junction is the ganglion, the junction is the ganglion, you can see. Now the ganglion, depending on the location of the ganglion, again it is of two types. What is sympathetic or parasympathetic? If the ganglion is towards the organ, pre is longer than post. You can see in the diagram also, pre is longer than post. It is known as parasympathetic system. And in sympathetic system, the ganglion is close to the central nervous system. So here post is longer than pre. You can see pre is shorter and post is longer. This is sympathetic system. So this is the meaning of parasympathetic and sympathetic. How many of you know that? You can see this is parasympathetic, this is sympathetic. See the location of the ganglion and tell me the length of the pre and post. Who is longer? So if pre is longer, it's parasympathetic. If post is longer, है ना, it's sympathetic. It depends on the location of the ganglion. So in both of them 2 neurons are there. In somatic it's very simple, only one is there. दो का चक्कर ही नहीं है ना. So this is the basics you must understand. Okay, got it? So this is the basics. So what we have learned? We have learned autonomic nervous systems are of 2 types, sympathetic and parasympathetic. ठीक है? Sympathetic में ganglion. See here, have a look here. In the sympathetic, ganglion is close to the organ. That's why preganglion is long, postganglion is short. But in sympathetic, the ganglion is close to the spinal cord. That's why here preganglion is short and postganglion is long. That is the first difference in them. Hana? The second difference, we have 12 pairs of cranial nerve and 31 pairs of spinal nerve. So from where these sympathetic and parasympathetic nerves are arising? So parasympathetic arise only from the cranial nerves, none of the spinal nerve. I'm sorry, only one spinal nerve. So cranial nerve, the 4 cranial nerve, 3, 7, 9, 10. There are 12 now. There are 12 nerves now. 3, 7, 9, 10. See, यहाँ से आएगा ये 3, 7, 9 और 10. और उसके अलावा it is coming from the sacral, craniosacral, directly from the ये सब cranial हो गया, directly from the sacral. So no cervical, no thoracic, no lumbar component. So craniosacral. Parasympathetic is also known as craniosacral because all the parasympathetic is coming either from cranial nerves or sacral nerves. है ना? Cranial में please learn 3, 7, 9, 10. Please learn, इस पे बहुत क्वेश्चन आता है. Please learn. और sympathetic you can see this is sympathetic. है ना? Sympathetic में cranial में से एक भी नहीं आता. All are coming from the spinal only. तो spinal में से कौन से? Which one? No cervical. It's thoracic and lumbar. So all of them are thoracic and lumbar, dorsolumbar or thoracic lumbar, one and the same thing. You got my point? So this is all regarding sympathetic and parasympathetic. You can see parasympathetic is close to the organ. That's why pre is longer than post. Sympathetic is close to the central nervous system. So pre is shorter than post. So this is the basic, you got it. The receptors are different. है ना? The neurotransmitters is different. Okay. Now let's talk about the neurotransmitters. Just a second. This is the summary in front of you. See the summary, everyone. Nervous system is of 2 types, central nervous system, peripheral nervous system. Peripheral nervous system, we have 2 types of nerves. Afferent, that is sensory, efferent, that is motor. Motor nerves are of 2 types, somatic and autonomic. Somatic में 1 neuron is there, autonomic में 2 neurons are there. Depending on the location of the ganglion, again it is of 2 types, the sympathetic and parasympathetic. Let's talk about the neurotransmitter and let me tell you regarding the receptors. What is neurotransmitter? What is neurotransmitter? It's a chemical which is secreted. So what is neurotransmitter? So neurotransmitter, you can see, I have written. Listen everyone. So neurotransmitter in somatic, we require only 1 neurotransmitter because only 1 neuron is there. So it is acetylcholine always. Acetylcholine. It is always acetylcholine. And we have muscarinic and nicotinic receptors there. Muscarinic and nicotinic receptors on the skeletal muscle. Got my point? Muscarinic receptors are there. So that is acetylcholine. But in sympathetic, parasympathetic and sympathetic, 2 neurotransmitters are required. One is preganglion, one is postganglion. Preganglion is always acetylcholine. Whether it is sympathetic, whether it is parasympathetic. It is always acetylcholine. But it is the postganglion which makes a difference in sympathetic and parasympathetic. The postganglion is different. Got my point? So postganglion in parasympathetic also it's acetylcholine. Both are acetylcholine, I mean. That's why it is known as cholinergic system. The postganglion is parasympathetic and here the postganglion is noradrenaline. That's why it is known as adrenergic system. So based on the postganglion neurotransmitter, we named them acetylcholine or noradrenaline. It's cholinergic system, adrenergic system. Preganglion is always acetylcholine. At the junction, it's always acetylcholine. Somatic mein always acetylcholine. Now the receptors are also different. Here muscarinic and nicotinic receptors are present and here alpha and beta receptors are present. So for parasympathetic system, cholinergic system, parasympathetic और cholinergic एक ही बात है ना? Parasympathetic और cholinergic system, muscarinic and nicotinic receptors are there. Acetylcholine will act on them and do the action. For sympathetic system or adrenergic system, alpha and beta receptors are there. है ना? So noradrenaline will be secreted and acts on alpha and beta receptors. Give me a thumbs up. Got it? How many of you got it? The basics. So this is the regarding the summary of the neurotransmitter I already explained. So that's why we call parasympathetic system as cholinergic system and sympathetic system as adrenergic system. This is the reason. What is the action? The last thing. What is the action? The action of these 2 systems, sympathetic and parasympathetic, is usually opposite, except some organs where the action is same. So see everyone on the screen. The last thing, the last concept. Sympathetic system is emergency, and parasympathetic system is relaxed. Currently, I am teaching you, you are learning from me, we all are relaxed. There is no emergency in that. There is no emergency. So I guess inside our body, parasympathetic is activated in me at least, है ना? For me it's not an emergency to teach you, right? But imagine we see a lion, we see a tiger, or there is some emergency in our life, we are running to save our life, है ना? So at that time the sympathetic get activated. Now we have various organs, we have eyes, brain, salivary gland, है ना? GIT, in lungs, heart, in all the organs both the nerves are there, है ना? So at one time only one is activated. So currently in all my organs from head to toe the parasympathetic one is activated. So in all my organs I am having acetylcholine secretion right now, but imagine in front of me suddenly a lion will come. So the parasympathetic will off and sympathetic will come and roll. So at that time all the same organs तो same ही है, all the organs will have sympathetic stimulation and noradrenaline will come and alpha beta stimulation will occur. Got my point? The basics शुरू से समझो. Got my point? हाँ. So let me tell you on each organ what is the function. We will consider the parasympathetic as a relaxed state and sympathetic during emergency. Fight, flight, emergency. So let's talk about the eye. The first organ is eye, the pupil of the eye. The pupil, inside the eye we have pupil and meiosis, mydriasis. So currently we are relaxed, we do not want much light, much vision. So it's meiosis. It constricts the pupil, है ना? So in parasympathetic there is constriction of the pupil, there is meiosis. But in emergency, है ना, कहते हैं ना हिंदी में आंखें फट जाती हैं, है ना? There is a lion in front of you, your pupil will widen like anything, है ना? So it is dilated the pupil, that is mydriasis. So in sympathetic system it mydriasis. So my pupil my iris have both the nerves. I am having parasympathetic also, sympathetic also. Currently in me if you see my pupil it's meiotic, है ना? So parasympathetic is activated, but in emergency it will sympathetic. So no need to learn, you can understand, है ना? Coming on the salivary gland, whenever we are relaxed we want to eat. I am very hungry, I don't have my dinner by the way. So after the session I am feeling hungry, my salivation is there, I can eat. But in emergency your mouth will be dry like anything. You don't have time to eat food, you have to run, save your life. So here increase salivation, here decrease salivation. Got my point? In the salivary gland also we have both, right? Come on the heart. In the heart also we have both. So currently we are in relaxed state. Our heartbeat is normal. If you measure mine it's 70 to 100 something in between. We are relaxed, है ना? So heartbeat is normal, that is reduced. But in emergency your heart will pump out of the body. It's beating like anything. Its a heartbeat will be 140 around if you have a lion in front of you. So heart rate increases like anything during sympathetic system. Come on the lungs. The bronchi. What will happen? Currently we are relaxed. We don't require much oxygen. Normal basal metabolic rate is there. So the bronchi are constricted. But whenever we have emergency, the lion in front, we have to run. Lots of oxygen is required. At that time, the bronchi will dilate. So you can understand, taking the example, always take example, relaxed and emergency. You yourself will come on the conclusion. No need to learn. Students used to learn these differences. You don't have to need to learn these differences. Got my point? So we have seen the eye, we have seen the salivary gland, we have seen the heart, we have seen the lungs. Now coming on the GIT, currently we are relaxed, so peristalsis is going on. We eat food, we digest food, peristalsis is going on, digestive organs are functional. But in emergency you don't have time, है ना? Exam है तो तुम्हें भूख नहीं लगती है, you don't have hungry, you don't feel, so there is no peristalsis. So decrease peristalsis, decrease pancreatic secretion, decrease gallbladder secretion. Here everything is stimulated. More stimulation of the gallbladder, more stimulation of the pancreas, more stimulation of the intestine, peristalsis is present, right? So that is the thing. Got my point? The last thing, urinary bladder, I want to explain you separately on a different page. On a different page. Very important. If you understand this basics now, reading the drug will be really fun for you. My way of teaching is very different. I will not give you anything rectification. I will explain you. See, this is the urinary bladder. In the urinary bladder, we have two muscles. Number one, the detrusor muscle. This is the detrusor muscle I am drawing. Detrusor muscle. And this is the sphincter muscle I am drawing. Sphincter. At one time, one contract, one relax. Both the muscles do not contract simultaneously, both do not relax simultaneously. Please understand this concept. Now, urinary bladder have urine inside that. The accumulation of the urine takes place. When the urine volume is more than 300, 400, certain critical level, we have a sensation of micturition. We feel like we should use the washroom and do the micturition and passes the urine out. So this sensation comes and person uses the washroom and do the micturition, the act of micturition. So whenever the person is not doing the micturition currently, just accumulating the urine, at that time the detrusor is relaxed. And sphincters are constricted. That's why urine is not coming out. Sphincter is constricted, it's closed, and detrusor is relaxed. So urine is accumulated. So this is normal. But when micturition takes place, है ना? Micturition के time क्या होता है? Micturition takes place, so detrusor contract. detrusor contract at that time, है ना? So all the urine will come out. When the detrusor will contract, the urine will come out. At the time, the sphincter relax. So relaxing the sphincter. So it is under voluntary control. We can contract and relax the sphincter according to your wish. Whenever we want to do the micturition, we relax the sphincter. Whenever we do not want to do that, we hold the urine, we constrict that. So detrusor and sphincter, the function is opposite. So detrusor is relaxing, the sphincter is contracting whenever the urine is accumulating. Detrusor is contracting, the sphincter is relaxing whenever micturition takes place. Say yes. Say yes. You got my point. Say yes. Now you tell me. You will tell me if you understand this. What happens during parasympathetic system and what happens during sympathetic system? Parasympathetic is relaxed. So if we want to do the micturition, we can do. There is no problem in that. We can use the washroom, and whenever there is a sense of micturition, I mean the urine get accumulated beyond a critical volume, we can do that. So during parasympathetic system, I mean to say the detrusor is contracted and the sphincter get relaxed. Am I right? During micturition. But during sympathetic system, there is no time to urinate. Even the critical volume is crossed, you don't feel the sensation of micturition because it's an emergency. Saving life is more important than to urinate, I mean to say. So at that time, the detrusor will relax and the sphincter will contract. I tried my best to explain you the things. So don't try to mug this concept. I have seen the student mugging it up. By parasympathetic detrusor contract hota hai, sphincter. By ratna kya hai? Samjho na. Parasympathetic mein everyone can micturate. It's normal. We all do so every day. Twice, thrice, 4 times a day we micturate. And in sympathetic system, we don't micturate whenever there is an exam, there is an emergency, there is something else. Okay, got my point. Say how many of you got it? How many of you got it? So in parasympathetic muscle, the detrusor contract and the sphincter relax. Right, this happens. The detrusor will contract and sphincter will relax, so micturition happens. Micturition is positive, it happens, but in emergency, the bladder will relax, detrusor will relax and the sphincter will contract, so micturition do not take place. I tried my best to explain you. Got it? So this is the biggest concept. Now these all organs, the action is opposite. You can see the action is opposite. Few organs, the action is same. For example, the male genital organ. What is the male genital organ? The male genital organ is penis. During sexual intercourse, 2 things happens in male genital organ. First, erection takes place and then ejaculation takes place. Right? Both are complementary, one after the other. They take place, of course, during sexual intercourse. So these are not opposite actions. These are complementary actions. Like they take place simultaneously one after the other. So here it is the only organ in which sympathetic, parasympathetic both are doing the same action. Erection is due to parasympathetic system, and ejaculation is due to sympathetic system stimulation. So a parasympathetic erection, sympathetic ejaculation. So it is the organ where the action is same or complementing each other. Rest all the organs, you can see the action is opposite. You got my point? So in male genital organs, male or female, both of them, I'm sorry. So for both of them, its erection is due to parasympathetic and ejaculation, orgasm or ejaculation is due to sympathetic. I hope you got it. Say yes, all of us. So that is the thing. That is the thing. So can you make it out? Now you get many questions from that. Believe me, that is the concept. The question किस पे था वो तो देख ले. So let me tell you what is the question. So regarding, where is my diagram? I told you, the muscarinic receptor. For parasympathetic system, we have M and N, muscarinic and nicotinic. Muscarinic receptors are basically 5 types: M1, M2, M3, M4, M5. But out of them, first 3 are important, M4, M5 are not important. So have a look on M1, M2, M3. Regarding nicotinic receptors, there are 2 types, NM and NN. So total 5 types of parasympathetic receptors are there. The parasympathetic receptors are of 5 types. What are the 5 types? M1, M2, M3. The 3 muscarinic. NM and NN, nicotinic में N1, N2 नहीं होता है, NM and NN, and in the sympathetic system we have alpha and beta. We have alpha, we have beta. Alpha is of 3 types, alpha 1, alpha 2, alpha 3. Beta is of 2 types, beta 1, beta 2. So this all we will see the details. Currently I am giving you the details of M1, M2, M3. ठीक है? M1 कहाँ present होता है? M1 is present in the stomach. In the stomach, causing acidity, in the parietal cell of the stomach and in the central nervous system, causing learning. M1. M2 is present only in one organ, the heart. And it is parasympathetic system. Muscarinic is present in the parasympathetic, so it is decreasing the heart, decreasing the rate, force, velocity, everything. It is decreasing the heart. It is decreasing because in relaxed system we have less heart rate, but in emergency it increases. So it is decreased heart rate, force, velocity, contraction, everything is less. M3 is present in all other organs. M3 is present in all smooth muscle, like in GIT, in the lung, in the urinary bladder, in the sphincter of the urinary bladder, in the eyes, in all glands of human body, like sweating, salivation, lacrimation, tracheobronchial, gastric, in the blood vessel, in the male sex organ. That is penis. So M3 is present everywhere else, and you can understand. Like अब मैं फिर से नहीं समझाऊंगी. I told you in GIT, consider parasympathetic system. Consider relaxed state. During relaxed state, the GIT is doing contraction, peristalsis. The lung is doing contraction because less oxygen is required. Urinary bladder, detrusor is doing contraction, but sphincter are doing relaxation. So micturition can happen, है ना? Eyes में you can see it's meiosis. ठीक है, glands में all the secretions are more because we want to eat during relaxed state. Blood vessels are vasodilatation, our BP is less. Less means normal, okay? And male sex organ में erection is due to this, but ejaculation will be due to sympathetic. So you can understand, है ना? So there is a mnemonic for that. M1, M2, M3 learn कैसे करना है? हिंदी में, if you understand. How many of you understand हिंदी? हाँ? तो पहले खाओ, फिर दिल लगाओ, बाकी सब काम बाद में. It's a small mnemonic, but this is a way to learn how to learn M1, M2, M3. M1 is पहले खाओ. पहले खाओ मतलब it is present in the stomach. फिर दिल लगाओ, it is present in the heart, decreasing the heart rate, contraction, velocity, and बाकी सब काम बाद में. So everything else is M3. So this is our question right now. How many of you got it? Huh? So this is the thing. Now the next concept is the biggest concept, meiosis and mydriasis, sympathetic, parasympathetic drugs. We have 4 types of drugs, है ना, in ANS. Cholinergic, anticholinergic, adrenergic, anti-adrenergic. Right now, if you understand the basics, ना basics समझ गया. अब drugs में कुछ नहीं है. They are like मक्खन. They are like cakewalk. Believe me, this is a way to read the ANS. Don't learn the drug. भाई atropine ये करता है. Learn the classification of all 4. You should know the classification at the tip of your tongue. What are cholinergic? What are anticholinergic? What is adrenergic? What is anti-adrenergic? है ना? And if you know the basic sympathetic system, parasympathetic system, the cholinergic will support the parasympathetic. Anticholinergic will oppose that. And adrenergic will support, I mean it will be the agonist of sympathetic, and anticholinergic will oppose that. So if you know the basic, you are clear. All the actions you can understand it well, and uses adverse effect we will find from that only. The biggest confusion is in the eye, but my time is over, so I want to end the session. But if you want more sessions on that, kindly write down in the comment box. Don't forget to give the feedback. We can plan more sessions on the PYQs of pharmacology, PSM, microbiology, and patho. We can arrange more sessions for that. Thank you so much for being with me. Thank you so much for giving your precious time to me, and being with me for the entire session, being interactive. Thank you so much, and I would like to end the session. If you have any doubt, kindly write down in the comment box. Otherwise, I'm ending the session. Don't forget to give your feedback and let me know if you require more classes. Write down in the feedback. Thank you so much. Bye-bye. Have a nice day. Good night, and wishing you all the best. I want all of you to get selected in this shot only. If you are a FMGE student and watching it for last time revision, I tried to cover many important topics here, right? So I want all of you to get selected. Once you get selected, don't forget to let us know also. Thank you so much.